Savage K, un representa SD671 production, the whole island of Guam. This is the front line.
Right on, let's do it.
Good
morning, Guam. 610. Containing COVID is the KUAM News takeover of Guam's favorite, and there's just so many ways for you guys to check out the show. We'll run them down for you real quick. Of course, right here on the radio, I-94 FM. It's 93.9 on your FM dial. We're also streaming on Docomo Channel 10. And live on our KUAM News Facebook page, of course. Good morning to you guys.
Where's that music coming from?
I don't know.
Where's that music coming from?
I don't know where it's coming from. There. You happy now?
Okay.
Good? Yeah, okay.
Rusty.
I got it.
Okay,
All
you
right.
sure do.
Yeah, so KUAM News Facebook page. We're also streaming live on the KUAM News app and KUAM.com.
Yes?
Yes.
Yes,
And
we
then,
are.
And then Monday, so we can talk about it now. Monday, we are going to be taking the show to the TV side, and it'll be on KUAM TV 11 from 8 to 10 in the morning. That's starting on Monday on this Holy Thursday. Sabrina Salas Mazzanotti. Good morning, Bree.
Hafid, everybody. Good morning. Oh, man.
So we have a big show, this, as always. I mean, just lining up people, and we wanted to go with a few of the doctors today to kind of see what they're thinking and what they're saying about where we're at in the war against COVID-19.
Right. So that and a whole lot more that we'll be having on the show today. But let's get right to some of the stuff that we're working on. As of last night, the latest release from the Joint Information Center came out around 9:20. Last night, Public Health tested 34 individuals for COVID-19 on Wednesday. 1 tested positive through Public Health, and 33 tested negative. Public Health's overall count also includes an additional 2 cases of COVID-19 that have been clinically diagnosed. And while these cases have tested negative, they have image findings consistent with COVID-19 and display symptoms, and they have epidemiological links to previously confirmed cases and are being treated as COVID-19 cases. The overall count also includes 11 positive cases that were tested by the Naval Health Research Center in San Diego and 1 confirmed positive case through the Diagnostic Laboratory Services. So, in total, the number of confirmed cases of COVID-19 on Guam is 125. The Guam Police Department, in the meantime, is mitigating and containing the spread of 19. Their Juvenile Investigation Division continues to enforce the curfew laws in coordination with the Department of Youth Affairs. GPD is reminding parents and legal guardians of minors to do their part to exercise social responsibility by talking to their children about how they can stop the spread by staying home and not coming in close contact with others. Between April 1st through April 7th, GPD's curfew enforcement efforts resulted in 17 minors taken into custody for curfew violation and all released back to their parents or legal guardians. The curfew laws are pursuant to Guam law and will continue to be enforced. The curfew hours are 10 p.m. to 6 a.m. on Sunday, Monday, Tuesday, Wednesday, or Thursday, and 12:01 a.m. until 6 a.m. on Saturday and Sunday. In the CNMI, Governor Ralph Torres and the Commonwealth Healthcare Corporation confirmed there are 3 new COVID-19 cases, bringing CNMI's total confirmed case count to 11. Of the 3 new confirmed cases, 2 are male, ages 45 and 53. 1 is female, age 53. These cases are being monitored by the CHCC medical teams at the Kanoa Resort. The governor's COVID-19 task force identified quarantine location. CHCC has already initiated contact tracing for the most immediate contacts, close family members, friends, and associates of these new confirmed cases. CHCC continues to work with the governor's COVID-19 task force to expand designated isolation areas to closely monitor the well-being of individuals with symptoms. Again, in the CNMI, the number of confirmed cases of COVID-19 now stands at 11. As for an update on the Theodore Roosevelt, as of today, 79% of the USS Theodore Roosevelt crew have been tested for COVID-19, with 230 positive cases so far. Additionally, 2,037 sailors have tested negative, 1,999 sailors have moved ashore, and 1,232 are in hotels. As testing continues, the ship will keep enough sailors on board to sustain essential services and sanitize the ship in port. There have been 0 hospitalizations. An update from the Department of Labor. The agency continues its preparation to implement the Pandemic Unemployment Assistance Program that will assist thousands of individuals whose jobs have been impacted by COVID. It was just last week that Governor Lou Leon Guerrero signed the agreement with the U.S. Department of Labor as mandated by the Coronavirus Aid, Relief, and Economic Security Act, or CARES. On April 6th, the Assistant Secretary of Labor, John Palish, and the Employment and Training Administration issued its advisory, which provides the details of the PUA program, operating, financial, and reporting instructions. We will have DOL Director David Delasola hopefully on our show a little bit later today.
Yes.
Meanwhile, senators, they are scheduled to go into emergency session at 10 this morning. No agenda was released, but KUAM counts 27 bills that have been introduced relating to the coronavirus crisis. This will be their first official gathering since the pandemic hit. Senators and a very limited number of staff will be present at the Congress Hall and will be observing social distancing measures, including wearing face masks and keeping at least 6 feet apart from one another. Meanwhile, yesterday, I know a lot of people have been asking about it over the last couple of weeks, over the last several weeks about public assistance and what our local government is doing to help the people of Guam that need help.
This is similar to, I think, what the federal government is trying to do in terms of our recovery rebate. And if I'm going to fine $50 million, that's not enough. Because my estimate.
Okay, so sorry, my bad, Bree. What happened? You keep saying I'm rusty, and it's coming true.
Okay,
so this is a clip here. This is Linda DeNorsi and Governor Lou Leon Guerrero talking about public assistance options.
Right.
Okay, so here we go.
Yeah, I think one of the things, if you go to the 311 and they refer you to the public service, they'll let you know ahead of time what kinds of documents you need to verify. And Linda's here. She could probably add more to it because public welfare is also under her oversight and responsibility. But I think if people are prepared with those documents a little bit ahead of time, they could probably have their applications expedited.
Yes, thank you, Governor. Yes, we have contact numbers, and we've added, as the governor indicated, to the 311. They'll call that number, and then they'll be connected to option 2, which will be for public welfare inquiries. And I'll just give you that number so you can help us to circulate it all around town. It's 735-7237, and that's with the Bureau of Healthcare Financing Administration at the Castle Mall. And we also have 735-7575 or 7576. Which will be the Bureau of Economic, also the Castle Mall, and the Economic Securities is for the SNAP program. And then we also have the Bureau of Economic Securities for the Northern region, which is 735-7488. And again, this SNAP program for the Bureau of Economic Securities at the Southern, you call this number 735-7542. Now, in regards to this, I've already asked Tess Archangel to be very creative with all my staff, so that we don't have them all lining up and crowding the whole public health. What we're doing is we're putting drop boxes. So whatever essential information as far as documents that they're going to need, they'll just drop it in the respective drop box. They can also email it, and they can also send it through the mail, the regular mail. Email's a lot faster, as you know. And so our staff will gather all this information, and whatever is missing, again, if you gather all the information that we need, we can process it in one day. And I was assured by my staff that that could be done. However, if you don't have the proper documents, we're also working with the mayor's offices, and they're going to help us as well so that we don't have everybody crowding everywhere. So the mayors can also, we're trying to get them to also accept all these documents, and then we can move these documents to our department. And that would expedite a lot of things. Right now, the biggest challenge that we're facing, and we're working on it, is that we're trying to get a list from the businesses that either closed down or they're furloughed their employees, to get the total number of employees that are on that list of those that have been furloughed or they're not working. And if we can verify that, then that will help us with the application process. Our staff are also in close communication with the Off-Island Food Nutrition Services Program, so we can see, is there any other creativity that we can allow? For example, just have a temporary period of when they can be under the SNAP program. And we're just waiting for that clearance. And if we can get that clearance done, if they can say, okay, we'll cover to a certain period, then we'll right away process those and let them be available for those who are new applicants. And so they can be eligible for the SNAP.
Of public health.
She is working with village mayors. There's a lot of documents that you have to have in order to turn in this application, and there are different ways that you can do that through the Dropbox or through email or mail. She did say these are the numbers that you can call aside from what the governor said, 311. You can call 735-7327 or 7575 or 7576. But again, they are working with the village mayors to help get the documents that people that are going to apply are going to need.
There's quite a list of documents. I know that's up on the website. So we're going to go to the phones where we have the president of the Mayor's Council of Guam, Deputy Mayor Melissa Savares. Good morning, Mayor.
Hi, good morning, Chris.
Hi, Mayor.
How are you doing, Mayor?
We're hanging in there, but we're there to support all the needs of our residents as well. I've been listening to Linda. I spoke to her yesterday about the documents needed for residents that have lost income and are needed to get their food commodities, their food stamps. So our offices have continued to work. Residents continue to provide verification. So we're not open to walk-ins, but we are there at the other end when you call the offices, and this is all the mayor's offices. Our residents can call their respective mayor's offices, and a staff will answer. We will get the name of the head of household, and then we have the email listing of the various Department of Public Health offices that take care of SNAP program. And so we email directly to the caseworkers. We found out yesterday that, last week, that Salvation Army and Catholic Social Services are providing some food commodities also to those individuals who have lost income due to COVID, and their application process does not require a mayor's verification. However, we at the beginning we were supporting those efforts as well, but working more closely with the Department of Public Health on the the SNAP program, we are emailing directly to the caseworker once we know which residents are in need of their documents.
So you're seeing a surge of people contacting your office?
Oh yes, we do. In our office alone, we've been doing over 150 verifications per day of residents calling. Yes,
just for public assistance.
So let me ask you,
because it's also including the renewal.
Right.
Yeah.
Wow, that's crazy. 150 mayor's verifications a day. And Mayor, is this a similar number with your colleagues on the Mayor's Council, or are we seeing this village to village?
Because the smaller villages, they have a few, less. I know that Gigo is up to that number as well.
Wow.
So, but it's also to include those that have received their letters of for appointments for their renewal as well.
Right.
So it's not just for the emergency food stamp. It's also for those who are receiving scheduled appointments, and they're using the Dropbox and email process as well.
How would you break it down, Mayor? Of those 150 a day, how many are new?
At least about 30 who are displaced workers per day.
30 a day times 4. So you're seeing over 100 displaced workers asking for the verification. And that's just in your village.
Yes, that's just in Guerrero.
Man, so what are your constituents saying, Mayor? Because hurts our heart. To go another month under these conditions. Money is drying up.
Mm-hmm.
Well, one thing is that because they're not out on the streets, they are saving gas. for those that usually go and drive around to work and whatnot. But, one thing that we're also seeing is the increase. We have 3 schools that serve the school lunches as well. And so the increased lines of vehicles coming in to the schools, there's more families lining up than we've seen in the past several days. So we know that families that are in need of food for their children are taking advantage of that.
Have you heard people are being turned away because they ran out of food?
No, last week there were 2 days. There were 2 days where some families were turned away because they ran out. But what happened is now they have limited no more than 10 plates per vehicle, and then no more. Then we have families that also walk through the gate because they live close by, and so they're no more than 5 plates per person. So they're not hoarding the food and taking for their neighbors. The neighbors actually have to walk in or drive in themselves now. Yeah.
Man, Mayor.
All right.
And so we're out there, GDOE and their contractors are feeding from inside, are passing out those food. But all the mayor's offices who have food disbursement from the schools are actually outside the fence helping with traffic control.
You were talking about how you're not seeing people, at least they're not out on the streets, but there are people that are out on the streets, the homeless population of Guam. Have you heard any other, or have had any other conversations with Adelup on what we're going to do or what the plan is?
Not as the mayor's council, but they have communicated with us via our executive director that they are still trying to find a way to house these people. And of course, we're trying to discourage the congregated housing because of the social distancing. I've seen over at our Guam San Jose, the shelter is not taking any new clients from what they already have in place.
What's the capacity at Guam San Jose?
They have 10 rooms that are for families, and then 6 individual rooms for individual persons. And so they also have, I believe it's 4 homes that are for the larger families just outside the structure of the shelter. And all those rooms and homes are occupied at this time.
Okay, Mayor.
Yeah, so do we got to call Angel Sablan, Mayor? Because, it's very, very, and there's so much going on, but we keep asking about the homeless. We asked a few times, and the answer we got since a couple weeks ago is that it's in the works.
There's no programs out there that provides for emergency housing. I know that there was a time when if there was a fire and that someone lost their home, there would be emergency housing that would be available.
We've worked with Guam Housing and GURA in the past, but of course their offices are closed at this time.
Okay. All right. Is there anything else you'd like to get out with what's happening in Derecho? Because it sounds like a whole lot.
Yeah. Where are we on the COVID, Mayor?
Where are we on the COVID? Well, we follow the executive order. We're still out there providing support. We've seen an increase in our senior citizen center participation as far as COVID meals delivered to the seniors. So seniors who were not registered at our senior citizen center have actually registered to receive meals for their senior citizen for themselves.
How many more? How many
in
new?
The last few days, I think Derito's increase on COVID meals was 20 additional seniors, and Estumbo was 6.
How many total, Mayor?
So in Derito is 226 meals, and then in Estumbo, I think we're still up to 140.
Okay.
Yeah.
So it just looks like more people
Yeah.
are needing assistance.
This is, I mean, we've been saying it, and now you're going to see that now that we're going another month, people are going to become desperate. They're going to come out. They're looking for food. They're looking for money. Mayor, can we talk about the lines of communication? Because I heard some things last night about the Mayor's Council of Guam, and we've had so many of your mayors, your colleagues on the show, and they're all kind of saying the same thing, is that they're kind of left in the dark by Adelup and this response and the communication. So where are we on that? Has it improved?
So one of the things is that they are concerned because the numbers continue to rise, and the concern that the mayors have is that they want to know how many individuals in their village have tested positive. And I understand with HIPAA law that we cannot know their individual names, but we need to know at least, because the reports that are coming out are by region, north, central, and south. And the concern is, the Mauricio mayor knows that he had two, but, they're a small community, and they want to know who the two were, or at least what area of the village they live in, so that they can make sure that they're not roaming the streets and infecting other people. The same way, and that's the village concern. That's the concern, is that we're still not getting the answers as far as what village they actually come from and what area of the village. I had a call last week from the Umatic mayor saying, are any of those southern residents that tested positive from Umatic? He heard that two of them were from his subdivision. Umatic, it's a very small subdivision, and he said he stayed up all night just watching to see if people that were walking around are coughing and, who they were, for the fear that, it could infect his entire small subdivision. So those are the concerns.
So what was the response?
Pardon?
What was the response?
We still haven't gotten a response on that. And that goes, that inquiry has gone on to our emergency operations, and so we have Homeland Security and Adelup staff that are on that request, on that chat. So
when you put your concern on the chat, you get left on
red? Are they leaving you on the blue?
That particular one has not been answered for the mayors.
Welcome to the club, Mayor.
All right.
How frustrating is it, Mayor, for you guys? And we keep saying this. You guys are such a valuable resource for Adelup to fold into the COVID-19 response. I mean, you guys are out there. You're with the people. You're seeing. I don't even think the governor goes around to see these people lining up to get meals every day. I don't, and I think she needs to get out and see where our people are, how they are suffering. Because when we ask her about local assistance, I don't hear the compassion. I don't, and it's just frustrating that we continue to beat our head against this wall and try and sound the alarm that our people are hurting.
Mayor,
they're hungry.
I was going to ask Mayor if you could just send us, if you could have one of your staff that are actually working at the grab and go or wherever, if they could send us some pictures so we can just show what's happening out there.
Yes, please, Mayor, because we're in our own restrictions here as a media. So as a company, we're not going out into the field because we're doing our part to help avoid the spread. But we definitely respect the work that you guys are doing, and it's so valuable. It's so valuable that the mayors are out there. They're out there helping with this grab and go where DOE is giving away 150,000 meals a week. That's 150,000 meals a week because people on our island are hungry and they don't have food.
Yes. Okay. Yeah, and it's not just in I spoke to the Inarajan mayor yesterday about, her concern was getting the cars into the campus before the time to start. And I met with the DOE board yesterday, and they are addressing all those concerns because it causes traffic jam on the roads. So yeah, we all are working with different agencies, but yes, we do feel the concerns and this of questions not getting answered. Okay.
Okay,
we'll
Mayor.
take some pictures and then
please, little video, shoot sideways.
Okay. All right.
Okay,
right,
thank you, Mayor.
Be safe,
Mayor,
and
God
thank
bless
you.
you. And you sure you're okay?
Oh, we're okay. Thank you.
Okay, wash your hands, Mayor.
Yes, we will.
All right,
Okay,
be safe.
thank you. Yeah, that's frustrating.
Yeah,
It's frustrating. It's pissing me off. Honestly, I'm just so I've been so angry about it.
They're turning away people from the homeless shelters. Sometimes they don't have enough food to serve everybody that's coming through the grab and go Department of Education program. The legislature, they are going into emergency session at 10 o'clock this morning. One of the bills that has been proffered, and we don't have an agenda, but we can only assume that this might be on the agenda, and it's a bill that was introduced by Senator Regina Bisco Lee along with 8 other senators. It's a bipartisan measure that would authorize a Guam funded taxpayer relief program. A letter was signed by 7 senators seeking the governor's support for local financial aid. The bill is a fiscal strategy. It's Bill 340, or the Recovery, Income Support and Empowerment RISE Act of 2020. The measure allows the governor to transfer up to $15 million from any government account to pay for locally funded financial assistance. The legislation can help up to 30,000 families by limiting eligibility to taxpayers reporting less than $40,000 in income for single filers and $80,000 for joint filers, granting $400 to eligible single filers and $800 to eligible joint filers, and allowing the Department of Revenue and Taxation to remit these funds using electronic means rather than distributing paper checks. Now, Mr. Lecanto, during yesterday's press conference with the governor, asked for her reaction to Senator Regina Bisco Lee's bill.
Yeah, I think this is similar to, I think, what the federal government is trying to do in terms of our recovery rebate. And if I'm going to fine $15 million, that's not enough, because my estimates in terms of the one-time tax rebate is anywhere from $130 million to as high, I think it's $150 million. So $15 million isn't going to provide for everyone. I think what we need to do is, again, work with the federal program. And I know Daphne, our director of Department of Revenue and Tax, is working very closely, like I have said. She's getting the details almost completed. Again, she just needs approval for implementation plan. We're actually, Nestor, in the scheme of everything in the United States, we're actually the very first area that had submitted our implementation plan, and I know that we are priority up there. And I'm hoping that within the next 2 weeks, 3 weeks, we'll be able to do that. Now, what I am also looking at is how can we advance payment, if we can, in terms of the tax rebate, the recovery rebate. And so I'm talking to Daphne and Ricky and other people to see if that's something that is possible to do.
To follow up on that, where would that money come from then? Where are you looking at? What source?
Which one?
For the advance payments on the federal funding?
We would be probably looking at payments back to us from the federal government, from U.S. Treasury, on the war reparations.
Okay, so the War Claims Fund. So let me get this correct.
So
the Treasury would the Treasury would advance you the funds, and then when it's time to pay individual adjudicated war claims, they just write themselves a check, kind of like
no.
Like.
So what if you remember our local war reparations program?
Oh,
what we did was we advanced our Manamto. we advanced them their war reparations claims, and what they did was they assigned their claims that have already been adjudicated through the U.S. Treasury, or not the Treasury, I think it's the War Claims Commission that had adjudicated these claims, and so we advanced the payments. What they did was they said, yes, government of Guam, I am assigning you my claims, so pay me the money through your local fund. And then what we did, we've been communicating very closely with the U.S. Treasuries. We were sending them a list. They were verifying, they were reconciling, so they have all that information now. So when 1365 passed, the Treasury then took over the program, took the program back, because now they can access the Section 30 monies. Remember those Section 30 monies that were put in a fund? They can access that money. That's close to about maybe 23 million, 24 million. Right. So what now we are doing is we are saying to the U.S. Treasury, okay, pay us back that money now that we have advanced. So they are now taking money from Section 30 and paying us back. So some of that money, we are going to be, we are looking at seeing how we can advance the recovery rebate till we can get again the recovery rebate program from the federal government to pay us back. So what we're doing really is we're moving funds around, as you can see, in a very maybe complicated way, but we are moving funds around so we can then provide our individuals out there with the much needed program. I mean, much needed assistance and benefits. So the other thing, Nestor, that can immediately also work is if the small businesses would apply for the paid protection loan, because then if they apply for that, they can rehire these people that have been unemployed. They can rehire them, pay them their paychecks out of the loan that they have gotten, and then the federal government will forgive those loans, that portion of the loan that is used to pay for payroll.
Yeah, I understand that there are a lot of companies that are actually
under this one.
No, stop.
No, okay, so
let's get somebody in here that can actually break this down in layman's terms.
Nestor Lecanto from the KWM news team. Ness, so
what was she saying?
What was she saying?
Okay, I think this was what I was confused with, what I wanted to clear up. Actually, the Treasury is sitting on over, and I think you heard the governor say that, over $30 million in Section 30 money. And that's money that, according to the law that former Congresswoman Madeline Bordallo passed, that was part of the NDAA back in, I think, 2017, anything in excess of $68 million, I think was the threshold, that goes to the Treasury for war reparations payments. So in the last couple of years, that's accumulated to a level of about over $30 million. But what the governor was referring to was the $11 million that was fronted by Gov Guam to pay for war claims that were adjudicated, and then there was an agreement that they made with the Treasury that, and with the individual claimants, that once they got their checks from Treasury, that would be reverted back to the government of Guam. So that's the $11 million that she's talking about. I was thinking that she was going to ask Treasury to release the more than $30 million that they're sitting on, and whatever was not going to any adjudicated claims, they could use that for now, and then once the federal stimulus money comes back, then Treasury could just write itself a check to reimburse it. That's where my confusion was with that. But what she's referring to is the $11 million that Gov Guam has already fronted to war claimants, and that they're waiting for Treasury to reimburse those claimants, or to pay that, and that money will be used. They'll do the same thing again with the federal stimulus checks. So they want to use that $11 million to pay out as many advance stimulus checks as they can, using the same idea that those people who receive that then will revert that back to the government of Guam.
I see, but that still doesn't address because I thought what she also said was in total it would be 130 or 150 or something like that to pay out all of the federal stimulus payments, was it, or something like that. Wasn't she mentioning that?
I think she was. Hold on, because I lost Nestor. It wasn't me being rusty. There's a technical thing that happened. So
Okay.
hold on,
So,
yeah.
so
Okay,
yeah, that
there
was
is, yeah.
Nestor kind of
Yeah,
breaking
there
down
is.
what the.
Hello?
Yeah, there you
sorry
go.
about that.
Sorry
Yeah.
about that. When did I get cut off?
I don't know.
You ended. I was asking a question actually about. You were talking about the was it 11 million that she's going to use from what we use to pay out the local war claims, and then reimburse for Treasury and use that particular pot of money to advance the federal stimulus monies, which we will get reimbursed.
Right. It's the same idea.
Right. But she also said that it was up to 130 to 150 million dollars.
Well, that's what they calculated it would cost to cover the entire stimulus check that will be coming to Guam.
Right.
So they've only got 11 million. So
Yeah.
they're going to try to pay as many people or pay as many of those checks out of that 11 million as they can. But obviously, it's just a fraction of what will be coming over.
Ness, because I was really confused by what the governor said, but did she say that Senator Regina Bisco Lee's bill that will provide $15 million was not enough?
Yeah.
So how is $15 million not enough, but $11 million is?
Well, it's not enough.
Yeah, I don't know.
It's not enough, but
right,
I don't
yeah.
know.
It would be conjecture on my part, but I'm thinking that what she's really trying to say is that it will be difficult for her to find $15 million right now.
Yeah. So did someone call you and explain try and explain what the governor said afterwards? Because it really.
Yeah, I spoke with someone from Guadalupe, and we talked about it, and so it became clear to me at that point that what she was referring to was the 11 million, and not the entire pot. Because the Treasury is sitting on more than $30 million dollars.
Yeah.
That is government of Guam money. That is Section 30 funds, right? But because of that law that provided for the payment of war claims, if we make more than 68 million,
right.
We make more than 68 million in a given year from Section 30 funds, whatever is in excess of 68 million goes to the Treasury, and that's set aside for war claims payments.
Right. But so basically what the governor said was Senator Regina Bisco Lee's idea is not going to fly. She has her own idea, and that's what they're going to run with.
They're going to run with this 11 million, and she didn't say it. I think the previous day she said I didn't say I'm not going to.
Yeah.
She got upset. It was not upset, but I felt like she was. I don't know if it was passion or emotion, but she said that she never said she would veto it, and then yesterday she basically said that no. I mean,
well,
that
she
was a
didn't
no.
say she was going to veto it. She just
Technically
said
she did.
that 15 million was not enough.
But 11 million is.
But she's got her own plan.
Yeah.
You know,
there you
and she plans on using.
What it comes down to, guys, is the cash flow.
Right.
Yeah.
I mean, they've got. She needs to make sure she's got money set aside to pay for essential services. That's number one.
Yeah.
We need to keep the cops on the roads for our safety. We need to keep the medical staff at CMH.
We need to keep the non-essential government employees getting a paycheck while they stay home.
Well, if you go through the priority list, it's going to be the essentials that have to be paid first.
Well, I think is interesting is that you have in the CNMI Governor Ralph Torres. He is already planning, and he's already going to start furloughing people because he's seeing a 48% reduction, right, as a result of the COVID crisis there. And so I think yesterday those notices or a list was supposed to be compiled by their agency heads to see who can be, the hours can be reduced, and et cetera. But I know that you had asked that question.
I asked the governor. I said,
whether we're
hey,
going to see any cost-cutting measures.
Yeah, and she said no.
Yeah.
She said that she's going to do what she can to keep employing the employees of the government of Guam, because she said if she furloughs them, then they're going to go apply for food stamps like the private sector workers are doing.
I'd be very surprised if there is not already a contingency plan for that.
Right, yeah. And I mean, God, no one wants...
Nobody
wants
that.
furloughs, but I'm thinking had we instituted maybe instead of they're getting a full paycheck, non-essential, maybe 72 hours or just some kind of gesture. But I just want the government employees to know that, man, and I'm sure they do. You look at what's happening in the CNMI, compare and contrast, very, very fortunate. Very fortunate.
And I think the way the governor explained it, because you want to try to minimize the hurt.
Right.
You don't want to. I think the way she answered your question yesterday, Chris, was that if we do cut these people or reduce their hours, they're going to move to the line for the social programs.
Right.
So it's going to be the same
long line.
Yeah.
All right.
But anyways.
Well, it's going to be fun.
The legislature.
Yeah, that's 10 o'clock
10 a.m.
emergency session, right, Ness?
Yeah, that's a 10 o'clock emergency session. All of the senators and very limited number of staff will be in the Congress Hall, and I'm sure they're going to get a lot of viewership on this.
Yeah.
And I counted 27 bills that were directly related to the coronavirus crisis, and at the top of that list is, Senator Regina Bisco Lee's bill that we just talked about,
right.
Which would cut $400 and $800 checks.
I'm wondering, as the rules chair, maybe she's going to pull some strings and get that bill on the floor.
Yeah, I believe so. I'd be surprised if it didn't make the floor.
Yeah.
But the thing with the legislature, and this was told to me a long time ago by the late great Frank Santos, is job number one is you got to count noses. Because if you ain't got the votes, it ain't worth getting to the floor,
Right, right.
So, and we'll see what of those 27 bills or any other new bills that they come up with are going to hit the floor.
Yeah, there's some good ones, man. There's some good ideas. We've been dogging the senators, but they've had some good measures that are just not seeing the light of day because of the postponement of the session.
And also, they're supposed to introduce or submit their amendments
in
before,
advance.
Yeah.
But how do you submit an amendment if there's no agenda? Ooh, that's like a chicken and the egg question.
Yeah, this is going to be a very interesting session because it's unprecedented. I mean, they're not used to working with limited staff to go copy.
Oh, they're going to have to get their own amendments. A day. Welcome to the real world.
So yeah, this will be must see TV.
Right.
Hey, Nestor LeConte over the KUAM News team. Thank you, Nestor.
Thanks, Ness.
All right, guys.
Okay.
All right, man. There's so much experience there with Nestor LeConte. We're going to take a break. We're coming back.
Want to do national news? Or?
Okay. Yeah, we can. Whatever you say, boss.
Oh, my gosh. All right, so make sure to tune in for a special session at 10 a.m. Yes, Jason?
Oh, yeah. One thing that we are actually trying to work on, I'm in Facebook Messenger with some of the AV guys from the legislature, because obviously everybody on Guam and abroad is going to want to know about this stuff. And we're just asking them to confirm that it is going to be carried on YouTube Live.
Right.
Because I know a lot of people are going to want it.
And Nestor was saying that it's going to be on their YouTube channel.
And we're going to share that out on our social media networks, right?
Yes, so people can monitor and watch.
Sorry, and I just got confirmation from their AV team. It said, yes, they've already prepared, and they're going to be broadcasting on the normal TV channels if you're not into the internet thing. But anywhere in the world, it is going to be live streamed on YouTube.
Right.
All right.
Okay.
GuamLegislature.org.
Okay, 854. We're KUAM FM, Agotni, Guam. This is Containing COVID on I-94. Good morning on you.
Social distancing. Esta es la
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Day Guam. This is Rocky Martinez, local MMA fighter. I'm doing all my training at home, so man, I encourage you guys, please stay home. Let's help the community out. Let's help the hospitals, the doctors, the nurses, everybody on the front line. If we all stay home, it helps them out. And the sooner we can do this, the sooner we'll get done. So I encourage you guys, please be a team player for the community. We can all do this. We can all help each other. And man, let's get through this. We're a strong community. So again, I encourage you guys, please, please, please stay home.
Hey, thanks for joining us. Let me run down all the ways that you can contain COVID with us. 93.9 FM on your FM dial. We're also streaming KUAM.com and on the KUAM News app, and on the TV. We're there, and the stream of the show is on Docomo Channel 10. KUAM News Facebook live stream, of course. You can also catch it over on I-94 FM's Facebook page. And then Monday, gonna figure out a way to do our hair up. We're gonna be going on TV, KUAM TV 11, especially for the Monomco, because the Monomco, they're set in their ways. We know that they watch KUAM TV 11 in the morning, so we wanted to bring the show containing COVID to TV. That starts Monday, and it's going to be 8 to 10 a.m.
8 to 10 in the morning, yes.
Right.
KUAM TV 11.
Bree, and then one of the things that you kind of been working on is this Stay Home Live Local Fridays.
Yeah, actually, we all have been. It's been kind of like a team effort. Everything we do here is a team effort. Chris has been reaching out to all of his friends that are musicians. Jonah Goncharfris also has been. And, we have some in-house musicians here.
Oh, do we?
So, yes, we do. So tonight at 6:30 p.m., we're going to have a Stay Home Live Local Friday edition with... I'm sorry, today's Thursday. I thought it was
Thursday.
Friday. Sorry.
Day 25.
Tomorrow we're going to be having another Stay Home Live Local Friday edition. So you don't want to miss that, because we've got performers not just from Guam, but from all over the world.
Right. Yeah. So that's it's really awesome. And you were kind of showing me some of the clips, and woo, that fugu, boy, goosebumps.
Yeah.
6:57. Let's go to the phones and get one of our favorite doctors here, Dr. Tom Shea, onto the show. Good morning, Doc.
Good morning, Chris. Good morning, Sabrina.
Hi, Doc.
How are you doing, Doc?
Good. I've been busy. We
Right.
haven't chat for a while.
I know. That's why I wanted to catch up with you, because I almost got my head bit off when I asked at the press conference about where we are with moving the maternity child health ward. Doc, after I asked that question, I got a deluge of messages on the social media where, from family members of pregnant women, and they're all saying the same thing. They don't want to give birth in a COVID hospital.
Yeah, well, those are good questions that you asked. I mean, that's a major concern, as parents, as grandparents, as parents, our child, our babies, our grandkids are always number one. We sacrifice our lives for them. So, you put a kid in a car, you put a seatbelt on, you don't just leave them just playing around in the back. But I think those are good questions. But, I think it's come to a point where, I've been watching this develop as far as the last 30 days go. And I can tell you something. The projections that the government has put out, I don't believe those projections of 3,000 deaths. That may be the worst scenario. I mean, worst scenario, why don't you just put down 40% of the island? It's gone. But, if you look at the curve, don't pay too much attention to the positives anymore. At this juncture in time, we already said, the government already said, everybody already said, and I've said it before, consider everybody's positive, right? So why are we still counting 100, 200, 300? I think the curve you need to pay attention to is the hospitalization curve. Look at how many people are hospitalized. That's going to be the key, at least for me. People like to see how many positives, but look at the hospitalization curve. It's been flat. It's been steady. It's been around anywhere between 16 to 22. Even if you go up to 25, that curve is still pretty good. So I think we need to pay attention to that particular curve and then look at the entire island. We're not New York City. We don't have high rises, the density like New York City, where everybody, you have 1,000, 2,000 people living in one big tower. We're not like that. So I think our situation is a little different. But that said, I still think we should have a solid lockdown, keep the gates closed. And I think I published it on my Facebook, my plan, the Shea plan. But,
oh, man, we got a Shea plan, Bree.
But, that just is because when I'm locked down, I'm like, okay, I lock myself down, but why is people still outside gathering? That's not right. Yeah. So if you look at the I think latest release from the public health, I think, these are the businesses that are exempted. wow, if you look at that list, it's almost like the entire island is exempted.
It's like 5 pages.
Yeah, but you look at all the businesses, it's almost the entire island is exempted.
Right,
As
right.
long as you're supporting somebody to the essential, everybody is exempted. You know,
Yeah.
even the landscapers are exempted.
Right.
You know, it's like
even companies that make signs that say COVID-19, wear a mask, are exempted.
Yes, but I think, you know, you have to be smart about this. I think what the governor's office should do is that, okay, we're going to exempt this printing company, but your printing company will only print for who? Healthcare providers, police officers, firefighters, the first line, media, for example, first line to keep us abreast. But I think they need to go over that list and tighten it up.
Yes.
Because right now, that is not a lockdown list. That is like, hey, we're going to give exceptions. Go ahead. And there's still no National Guard outside. You know, in my first letter back in mid-March, March 16 or 17, when we wrote that letter to lockdown, and if you look at New Zealand, the study came out in New Zealand, how they're not just flattening the curve, they're really smashing that curve.
Right.
And why? Because they had a strict lockdown from the very beginning. So we're not just playing around. We need to make sure that we do it. But I'm a little concerned that we're trying to drag this thing on. So because whenever there's federal funding that's involved, you have to be very careful because you have contracts going out, you have, you know, things going out there that, hey, if we prolong this, how much money can we get? I hope that's not the case. Maybe I'm just being paranoid.
Well, I have heard from some people who say that at the end of this, if we play our cards right, the government of Guam, I mean, private sector is shot. That's done.
Yeah.
They might be sitting pretty on a big mountain of federal cash.
Well,
I mean, we'll see.
I hope that's true, but let's not sacrifice the community for that.
Right, yeah.
You know, I think you have to think about the private sector. You have to think about the hotels, the people who work at the hotel that need to get their jobs back. And certainly there's a stimulus package. But there's a lot of small businesses out there that you have to think about. You can't put everybody on welfare. That's not right. The unemployment rate in the country, I think, is double digits now. So that's not good. So that means we're heading to a recession. The only way to get out of the recession is concentrate, focus on getting over this crisis. That is the only way. No amount of money that you're going to get is going to sustain your recession. There's no way. You know, I think there's an old saying, right? You don't just give the people rice. You teach them how to grow rice. And that's very, very true. You can't just give them rice and then expect them to sustain that. No way. Teach them how to make to grow that rice. So I think that's an old Chinese saying. I think my grandmother was telling me about it.
Yeah, there's also one about a fish.
The one about fish, right?
Don't teach a man to fish. And
Exactly. You know, I mean, common sense. We got to use some common sense here. There's no models, okay? Nobody's going to convince me that's a model that's, okay, we're going to use this model, and this is the projected death rate, all the way sky high. And then let's send this to the federal government, and let's tell them this is what's going to happen. It's not happening, okay? Because look at hospitalization curve. And let me tell you why I have hope, Chris. I have hope for the island because why? The mothers and baby are still at GMH, okay? And I think the governor is smart enough that if there was a severe crisis at the hospital, the mother and baby will be the first one out of there. And they're still there, and I trust, and I've gone over some of the protocols because I come to a point where, okay, you know, I have made my recommendations, but let's get on the team. Let's be a team player. So I'm coming on as a team player. Let's keep the mothers and babies safe, and let's keep them away from the COVID patient at Guam Memorial Hospital. So that's going to be the key for me right now is focusing on keeping moms safe because right now I think our admission to the hospital is steady, and I think that's a good thing. And I think Jolene Agan and then the ICU team, the emergency room team, should be applauded for keeping the hospital low in admission rate for COVID-19.
Right. Doc, so does it just reach the point where you guys are just dealing with it? You know, I mean, we made a lot of noise about moving the women and children out of there, but, you know, obviously Lillian said the priority is going to be for elderly and adult patients.
That's what I don't understand. Why would you want to say something like that? Why would you want to say something like women and children are not a priority? Women and children always should be the top priority. They're the most vulnerable population. They're not the least vulnerable population. You know, women and children, babies are the priority in my opinion. You never go in public and say women and children are not a priority. When the Titanic is sinking, who goes first? Women and children. Not you and me.
Yeah, yeah. We'd be helping the women and children off. Right?
Yes. So that tells me right there, okay, that if the women and children are not a priority, that we're going to be okay. I'm hoping that's the case, right?
But do you think that she does have a physician's advisory group?
Right.
That, you know, the governor does. Or do you not feel that they're telling her that children first, babies and women first, or the vulnerable population of the Minocco?
Yeah, I know everybody who's on that physician advisory group, and they tell me that what they tell the governor still decides on her own.
Right.
But that's up to them. But you got to look at the physician advisory group. You know, I think half of those physicians don't even have hospital privileges, so they don't even go to GMH. But my concern right now is how do we get out of this mess? Right? We all want to get out of this mess. I'm tired of cooking myself.
Hey, those videos are pretty cool, though.
Yeah.
Well, after this, I'm going to have all these recipes to share.
I didn't even know you could cook.
You know?
Oh, man.
Yeah. Well, last night I had cereal, so that was really
oh, that's Bree's favorite.
I didn't get that.
That's Bree's favorite recipe right there.
Actually, breakfast dinners are actually very, very good.
Yeah. So, I had a fried egg sandwich last night, Doc, with some turkey breast on it, and
there you go.
A slice of cheddar cheese, and then I put a little bit of Denancy and some sour cream, and then I dipped my sandwich in there. And
hey, for the record, I can cook. Okay.
Well, I want to see. I need proof, Bree. Doc, thank you. We got to go, but thank you so much, and you continue to be a voice, advocating for the women and the children, and we appreciate you. And I thought that was an interesting comment you said about some of these doctors advising the gov maybe haven't been to the hospital.
Well, to me, I think everybody should have privileges at GMH and come walk the halls.
Right.
Unless you be up there helping out, help Jolene, help the ER, help whoever's up there. I don't think they should be commenting on what we should do for the hospital. Come on up. Look at a pediatrician. None of the pediatricians in the community go to the hospitals anymore. Zero. So, ask the pediatrician, how do they feel about the babies? How do they feel about the pediatric population at GMH? Yeah. But I'm reassured that I think we're going to be okay. And don't tell me the governor of Guam is going to say we're going to have 3,000 deaths just because. Why? The women and children are still at GMH. They haven't moved. We're going to be okay.
Well, thanks, Doc.
All right.
Take care. All right, take care.
Yeah. There you go. A message of hope from Dr. Tom Shea. That's one way to put it.
Yeah. He's always real.
Yeah. It's a 707. And, talking about the doctors on the Physicians Advisory Council, we do have a couple of them on a tap for the show this morning. And for the audience, Bree, it's Holy Thursday, Holy Week. Mm-hmm. We had a good message from Father Paul a few days ago. And this morning, we're going to get Father Richard Kidd.
Nice.
From the Maina Church.
Okay.
And he's going to come on around 9:30. Holy Thursday, we're doing the masses, and we'll bring Jason on to talk about the mass schedule coming up. It's 7:07. We're KUAM-FM in Hagatni, Guam. And let's do some national news.
Oh,
yeah.
Okay.
What do you think?
All right, I think we should. Nearly 2,000 Americans died of the coronavirus. It's the most in a single day by far. The death toll is now fast approaching 13,000, and those numbers could even be higher because of underreporting. Michael George has the latest from New York City.
Just 5 weeks ago, only 9 people in the U.S. had died from the virus. There's been rapid acceleration. In New York, around 730 people died Tuesday alone, nearly one person every 2 minutes. But there's some good news.
We are beginning to see some flattening of the number of new cases per day in specific metro areas.
One doctor who treats COVID-19 patients inside New York's Mount Sinai Hospital says she's encouraged by the number of patients coming off ventilators.
I feel hopeful because as a critical care physician, this is what we've trained for. We know that this is what we have to do, and we know that we're well equipped to do it.
Hospitals are still trying to find room for all the patients who need treatment. Many are coming here to New York City's Javits Convention Center. It's now an Army field hospital, and last night the Pentagon announced it will be sending even more beds. Across the country, the elderly at nursing homes are being hit hard. There have been 42 deaths at the Life Care Center in Kirkland, Washington. Another 32 people passed away at the Canterbury Rehabilitation and Healthcare Center in Virginia. And in Los Angeles County, the public health director now says it's appropriate to pull loved ones out of long-term care facilities if you're able to care for them. The mayor of Los Angeles has also ordered all essential workers wear face coverings.
Employers are required to provide these face protections or to reimburse employees for their costs. This applies to workers in grocery stores, drug stores, restaurants, hotels, taxis and rideshare vehicles, and construction sites.
The economic impact has been severe. American Airlines just dropped its LAX to JFK nonstop flights, and Burbank shut down one of its 2 terminals due to lack of business.
Okay, if you're just joining us, there are now 125 confirmed cases of COVID-19 on Guam. That's the latest from the Joint Information Center. The results coming out at 9:20 last night. In the CNMI, there are now 3 new COVID-19 confirmed cases there. The number of confirmed cases total is at 11. As for an update on the USS Theodore Roosevelt, as of today, 79% of the USS Theodore Roosevelt crew have been tested for COVID-19, with 230 positive cases so far. Additionally, 2,037 sailors have tested negative, 1,999 sailors have moved ashore, and 1,232 are ashore in hotels. As testing continues, the ship will keep enough sailors on board to sustain essential services and sanitize the ship in port. There have been 0 hospitalizations.
Okay, it's 7-Eleven containing COVID. We're going to take a break, do a little news from the KUAM news team. And, you know, Adriana Cotero had a great story last night, Bree, and this is something that we talked about on the show yesterday.
The Department of Corrections?
Right, somebody said Department of COVID, but I don't think we should.
No,
yeah,
it's
not even. Okay, so
too soon. That's
7-Eleven. We're going to get Adriana on in a bit, and then, of course, more doctors on the show containing COVID. Good morning on you, Guam.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Today, I'm Jonah Goncharfris, Senior Producer for KUAM News, and I'm sure you are probably tired of hearing it, but I'm going to say it one more time. I urge you to please, please stay home, to protect your parents, grandparents, manamko, loved ones, neighbors, hell, the entire island. Stay put, stay home, make sure you wash your hands, practice social distancing. I know it's hard because we miss hanging out with family and friends, but the sooner we do our part, the quicker we'll get back to our regular routine. We will get through this. Thank you, stay safe, and stay home.
Feels like longer than forever, yeah. My home is now a distant. Have you ever seen the yellow Musk Mountain? In this lonely summer night. It takes imperfect parents to show you the right way, and the perfect parents to show you the wrong way. Singing, don't worry about.
Joshua Manson out here. I can't wait for him to come home. Keep us safe and stay home.
What's the matter with your head? Oh yeah. Hey, what's the matter with your mind and your side and whoa? Hey, ain't nothing matter with your head.
I know we're going through a lot, Guam, but don't forget to smile.
And jam with us.
Yep.
On Friday.
I gotta let this hook rock, Bree.
Look so divine. Come and get your love. Come and get your love.
Hey, the boys in Rock Bottom. That's a classic cut, man, from Live Local Fridays, and we're doing a Stay Home Live Local Fridays. That's going on tomorrow night on the social media networks at KUAM.
Yep, 6:30 p.m. KUAM TV8. We've got performers from all over the globe. Someone from Afghanistan, Matt LaGuatnia, Peter Cruz, I believe he's in California. Vern Cruz.
Unbreakable Bloodline from the ATL.
Oh,
Georgia.
There you go.
Right, yeah. He's got a cool, it's like a spoken word kind of deal.
Mhm.
Right, yeah.
Fat Tofu?
Fat Tofu, yes. My friend Jordan from Fat Tofu. So check it out. That's going to happen 7/16. Let's get Dr. Vince Akimoto on the show. Good morning, Doc.
Hey, good morning. Good morning, Sabrina. Good morning, Chris. This morning is a good day, and thank you guys for keeping everybody upbeat. Obviously, you need to be just a little careful. It is Holy Week, and so tomorrow, Friday, we're all supposed to be a little quiet. But there's good news. I think the general feeling in the medical community is that the lockdown is working. We're starting to feel that the data is showing that what we're going through right now is probably the worst of it. We're hoping that our hospitals continue to maintain their ability to absorb any surge that was expected. There are still too many people getting sick, and unfortunately there have already been several deaths, but the majority of the people that are getting this disease at this point, and I guess maybe that's a little too strong, the trend is towards more people getting better than dying, and certainly even avoiding very serious disease. So the concern was always the hospital, that the hospitals would be overwhelmed, and then there would be unnecessary deaths because the hospitals couldn't do a good job with all the patients coming at the same time. So the hardworking people at Guam Memorial Hospital and GRMC all deserve our love. They're still standing by. They're still working very hard. There's still too many people that are sick in the hospital, but there's still capacity. Both hospitals are indicating that they can absorb more sick people if necessary, but the other good news is it looks like the military has agreed that if push comes to shove, they're going to also contribute their resources to helping Guam. And so there's a good feeling this morning as we go into this very special weekend. And it's not to say that it's over, right? It's to say it's working, because we've been hearing a lot of bad news. And so this would be the good news, is that what you're doing is working, but you still need to listen to Governor Leon Guerrero and stay home and try to avoid getting people sick unnecessarily. Try to avoid yourself getting sick. Do the things that are going to keep you healthy. And one of the big things is don't get into car accidents. Don't become a motor vehicle fatality during the time.
This is the science of it, Dr. Akimoto. Let me just give you the science. If you stay home, you won't get into a car accident.
Yeah, so please be careful, because I think unfortunately somebody may have died this morning, right?
Okay.
So
We'll follow up on that.
There's just too many other things going on, and even if you're completely careful, sometimes you're going to get sick from something else. So that's the reason for this call. Sorry to maybe bring up another issue, but there's a lot of people who had heart attacks, who had strokes, or who have bad diabetes, or their kidneys were failing. They need to see their doctor today. They need to get in and get their medicines checked. They need to get their blood pressure and vital signs checked, because we want to anticipate their storm, their medical problem before it winds them up.
Right, yeah, because it's not like you tell people, hey, don't have a heart attack or a stroke, everybody, we're dealing with COVID-19.
Yeah, people have apparently done a pretty good job of that, though.
Right.
I mean, I'm very, very thankful to people that do have these medical issues, because I guess they're also taking care of themselves, because we haven't seen that wave of of heart attacks and strokes that we thought was going to start happening. But that's early because we've only been in this lockdown for about 3.5 weeks. And
25 days.
The reason for the call is that generally that's when people start to run out of the medicines or start to lax up on what they're doing.
Right.
We're normally seeing people, if they're very sick, every 4 weeks, every 4 to 6 weeks. So the timing is perfect. People need to get into their doctors. I know it's a little bit of a confusing message because the governor has said to stay home, but she also said that for essential activities like going to the doctor, the risk is worth whatever benefit that we're going to give you, which is mainly to make sure you're okay and make sure that the medicines you were taking, a month ago or a month and a half ago are still the right one. So again, the message today is get in and see your doctor. There are several clinics that are open, including STA, FHP, and the American Medical Center. The idea is to people call your regular doctor, and if your regular doctor is not available, then go to one of those 3 tier 2 clinics that are also doing the coronavirus testing. But several clinics, including ours at American Medical Center, have divided the testing into separate sites. And so Manilao Clinic during the day is the clinic where people with fever and cough go. But the other 2 clinics, both near GMH at the OT Doctors Clinic facility, as well as our Upper Tuman Clinic, are called clean clinics, meaning we don't see people with fever and cough during the day. So you should feel safe coming in that you're not going to be exposed. At any rate, call your clinic, find out the specifics of it, or go online and check all these different clinics. They have excellent presentations and web presence at this point in time.
I just wanted clarification because people do still ask this question if they can just come in or call ahead just to get testing even if they aren't experiencing symptoms.
That's becoming more and more of a confusing thing today, because I think the other day we were more certain, I think on Monday, that the large shipments of tests had come in, but Public Health is telling us that they're running out of their very sophisticated tests. Meanwhile, we're expecting a very important quick test to arrive soon, but all of this stuff is sort of dynamic, as they say. So testing at this moment, this Thursday morning, still short on resources here on Guam in the local community. I just need to point out that meanwhile our military partners are doing 500 tests a day. They've tested over 3,000 people on that ship, and so it's amazing what you can do when you have upper management that's working well together. That was a snarky remark.
That was, yeah, I like that. Deadpan.
Testing on Guam in the private sector, in the local community, not very good right now. And so you need to talk to your doctor about whether or not testing is going to be possible for you. And the test is really just another thing. What we really need is to stop the disease. And so if you're sick, don't be going out around spreading it, and especially don't spread it to your nana. If you're not symptomatic, presumably you're not as infectious, you should still maintain distance. But yeah, you can work. I mean, if you're not positive, if you haven't tested positive, and you don't have fever or cough, you can work. Wear a mask and do the things that you need to do, and stay healthy. Go to sleep on time. Quit smoking. Quit doing drugs, and quit drinking too much alcohol. I mean, I hate it when people come and ask me for a test and they have cigarettes in their pockets. I'm pretty much ready to say no.
Right on.
All right.
Okay, Doc.
Thanks, Doc.
We got your Dr. Ho on the line. Thank you, Dr. Vince.
Bye.
All right.
Be
Well,
safe.
he woke up on the right side of the bed. I mean, Dr. Vince Akimoto saying be positive. That's Dr. Hoa, good morning.
Dr. Hoa, half a day.
Yeah, a good half a day, Suprema.
Are you okay?
I'm okay. Yes,
Okay. You sound like
so
you're exhausted, and I'm sure you probably are.
Right. Doc, I kind of had a question I've been holding for the week with the COVID-19 kids who have tested positive. What can parents expect, and how worried should they be?
The kids are usually doing better than adults, so the parents just need to work with the pediatrician there and keep an eye on if he's have problem breathing or not. But kids are usually doing okay. It's the parents that try not to catch the virus from the kids, especially if you have some grandparents in the house. We've been telling the family that keep the grandkids away from the grandparents. So that's the most vulnerable population we have there.
What about kids with pre-existing medical conditions like asthma or?
They still doing pretty good, Chris. The kids relatively doing pretty good. We have a lot of adults that have the same thing, but more likely an adult that they have some event. But I don't think that we lose so many kids, even in the United States.
Mm-hmm. Yeah, well, I think what was concerning for me is that when Linda was breaking down the connections to the kids that were sick, there was like a birthday party she mentioned, and I'm not sure where this birthday party was or how many kids may have been there, and just kind of makes me wonder if we're going to see even more children.
Yes, I mean that's the unfortunate part. Some people still not heed the warning, and they still have those party or get together. We just really wanted to put the message out there that the action you did, you're gonna lose someone dear and love to you, especially the elderly, just because you get a whole bunch of kids, whole family together.
Mm-hmm.
So everyone looked fine, but you had to pretend like the person next to you had a COVID-19. So if you decide to do a birthday party or whatever event you're trying to do.
Well, Easter's this weekend. That's why I wanted to just make sure we stress and put the word out to people that don't even think about having an Easter party or anything.
It's not. You're going to lose your parents. You're going to lose your grandparents. You lose your neighbor. And respect them, because you want to see them back next year. You don't want to lose them in the next few weeks. So really, people can be asymptomatic and have absolutely no symptom around you, but if you give to the elderly, the fragile one, you won't see them. So love the family, love your parents, love your grandparents, love your neighbor, and respect them by not any type of event that put people together.
Right.
So you really have to stress that a lot of this. We have our culture of in Guam that we tend to get there for this event. But I tell you, social distance is so important now, along with masks and hand washing, that please do not do this. We have many more Easter to come. Just skip this one. Separate your family at home by itself. Again, keep away from your grandmother, your grandfather, because they're so high risk right now. And that's why I tell, keep your grandchildren 6-10 feet away from you. Just tell them they love you, but don't hug them for now.
Mm-hmm.
Well, Doc, how are you guys doing with the testing at your clinics?
We're doing very good. Chris, we kind of run low on the actually not the test itself, but the test kit. It has to be everyone run low. Public health run low, DLS run low, just because we've been using more than it's supposed to be. So we right now try to save those for the most needed one, like the one in the hospital, or the one that we deem very sick at the clinic level. But I asked the doctor to try not to swab everybody, especially the asymptomatic one, because conserve those things. Now, we have a rapid kit test that's hopefully come up next week here, and we are putting together a plan of who we're going to use it for. We have to use it very meaningfully to make sure that we work with public health to try to track the positives, and we have to do some spot check, make sure the kids don't have any phones negative or phones positive. So that's a plan that we're going to talk about tonight with the Governor Advisory Board and try to implement this thing hopefully next week.
Can you explain a little bit more about this rapid test kit? Is it like a swab and you're done, or you get the results instantaneously, or you still have to wait?
No. This one is measure the antibodies, measure IgM, IgG. So it's like a screening test. It's not like a confirmatory test. So it's a screening test. So basically, it's like an acne check. You just need one drop of blood, and you can figure it out about 10-15 minutes to see if you have the antibody or not. Again, this is a screening test. It doesn't tell you for sure that you have it. If you want to kind of confirm that, then you have to still do the swab, the nasopharyngeal swab, to confirm it. But at least you can screen somebody. Just like when you come in to have you have a sore throat and you're doing rapid strep, rapid flu. Those things are not confirmed, but those are screening. But the screening sometimes is very good. So you just have to have a physician have good judgment, decide who to give it to, okay? And if you think that the patient looks sick, but the test is negative, then you have to work with public health to try to swap this patient to make sure the test doesn't give you a false negative.
How does this work? So the government of Guam, public health receives the rapid test kits, and then it deploys it out to the health centers?
Right now, we try to get government of Guam to purchase this, and basically designate certain clinics to do the testing. You want to control, the test kit, and because if we pass it on to everybody, everyone's gonna use it sometime unnecessary to asymptomatic patient, and so we waste a test kit. One is kind of far and few. You got to use it, in a meaningful way. Again, you have to use it in accordance with public health, and working with them, and I know there's a lot of companies want to take this in and test their employee. I tell you, that's very dangerous thing to do, because you can test negative one day, send the person back to work, and the next day they will get infected.
Mm-hmm. So then would our money be better spent on getting the regular test kits as opposed to the rapid test kits?
The regular test kit is far and few still. Sabrina, right now, just like, we don't receive thousands and thousands of those regular test kits from CDC to come in. But let's say that just a person like you, still young, have no comorbidity at all, and you come in, have some cold symptom or maybe some low-grade fever, more than likely, I'm not going to use a regular test kit on you just because I want to save that for a person that have more comorbidity that will not do well.
Right.
So I just tell you, go home, stay home for 2 weeks or so, and if you have symptoms, worse symptoms, you call me back. But you are a person that perfectly come in, have some low-grade fever, some coughing. Yes, I want to do the initial test kit on you because, like I say, it's a screening test. So you're a perfect candidate for mild symptom that we don't usually use a regular test kit, but now we can do the rapid test kits on you.
How far away are we in seeing these rapid test kits on Guam?
It's supposed to sometime arriving this Friday or early next week. Right now it's to work with Guam to secure a fund source to get it. When they have a wholesale place in town to bring it in, it's just that the government needs to move really fast to get our funding to secure this thing.
Okay. Wow. So the meeting with the Physicians Advisory Group is tonight with Public Health and the governor?
Are we going to live stream that, Doc?
No. It's closed door, but the government will not be there.
Okay.
Public health will be there. There's about 12, 15 physicians on the group, and we just come up with some recommendation for her, and we pass it on to Dr. Mike Cruz and bring it up to her.
And real quickly before we let you go, because we've got Dr. Felix Cabrera holding. Somebody is asking us, can you get COVID more than once?
I think that one is still up in the air. You have one answer now, and then next week someone will give you a different answer. But right now, from my understanding, you got immune to it. But like I say, the COVID-19 cold symptoms change in many ways. So the question is, the answer is never. There's high possibility you can if they're changing.
Okay. All right. Thank you so much, Dr. Hoa.
You're welcome.
Okay.
Have a good day, guys.
You too, Doc. Hang in there. Wash your hands, okay?
Okay, thank you.
Okay.
Wear the mask.
Yeah.
Thank you, guys.
Got it.
Bye-bye.
There you go. Dr. Hoa from American Medical Center. 7:30.
He's a great guy.
He is
I have to tell you, he's really great.
And so we catch up with him tomorrow.
Okay.
Because if they're having that Physicians Advisory Council meeting tonight.
And he said Friday, right? The rapid test kits.
Right.
Should
and
be,
so
getting here.
Linda's been saying this because if you look at the comments, everybody's talking about, over here they test so many people, we need to do more testing, and we've all been saying that. And this whole time they've been trying to do things to build the testing capability, getting creative, right?
Right. And then she also mentioned that they were that public health was receiving some other sort of test kits that could run through one of the other machines that they have there. I believe it was called a Gene Expert. So that would be another machine that could run tests on top of the ABI, I think that she said. I'm not 100% sure what that machine is called, but they have the one that they received, and then they use that for regional testing, for FSM, for Saipan and Guam. But they have an existing machine called a Gene Expert, and they're actually getting this test kits that they can use and run through this machine that they currently have, which would increase their testing capabilities.
All right, and let's keep it going with the doctors. Geez, I feel like I'm at the hospital. We've got all the doctors this morning. He is from the Physicians Advisory Council. You know him as, someone said Dr. Doomsday. Dr. Cabrera, I just wanted to start you off with a laugh because I know you're going through a lot. And, you know, with everything that we're going through, I just can't forget to smile, you know, once in a while.
Absolutely. Yeah. Big good morning, my sunshine, Chris and Sabrina.
There you go. Morning. So, Doc, you know, the message that we're hearing this morning, and I don't know if this is just you guys are giving us a little pep talk, but a lot of the doctors are saying that we stay shelter in place, we keep doing what we're doing, that, you know, the curve is going to be flattened. What do you think? What are your thoughts on that?
Yeah, you know, so that's fine. I can be Dr. Doomsday. I can be the weatherman that everybody loves to hate. What have you? You know, just don't kill the weatherman. The main thing with projections, right, is that it's very important to note that projections, especially from epidemiological models, are not meant to predict the future. Mm-hmm. Rather, they describe a range of possible outcomes that are dependent on our actions as a community. They serve as a guide for the community actions to help limit, coronavirus spread. For the government and healthcare planning that, creates a stepwise march in addressing medical and social demands.
Doc, so just real quick, the Physicians Advisory Council meeting tonight. What are we going to be discussing? And if you could just describe, if we're at a crossroads in containing COVID, where are we at right now?
Earlier when we had some of our earlier projections and we really had a lot unknown and we were really just, trying to project the worst possible scenario, the most plausible worst case scenario. It was almost easier then because it was, that we had a trend that was pretty much, following along. But now there's a lot of ups and downs or noise, as I would, add to it, as we're trying to recalibrate things based on the new data that we've had even just over the past week. And because of that, there's right now, I would say a larger degree of uncertainty, especially over the next probably several weeks, going into May. And what I'll say is that we're adjusting our worst plausible case scenario, and that's looking a little bit better. Right. And our trajectory right now is I would say optimistically better. Right. It's away from the worst case plausible, which is good. But it's like the same thing as saying, we know there's a super typhoon that's several hundred miles away or 1,000 miles away, and it was raining. It was raining yesterday, and it's sunny today. But doesn't change the fact that the storm is off our shores.
Right. Doc, I'm team Cabrera. You know what I mean? I'm with you. I think that I think our people are in a place like we understand what we have to do. You know what I mean? We're not, looking for hope. We're in this for the long haul, and I think everybody's kind of on the same page. And, in your defense, you're right. The projections you provided, they were a range. And then one of them is if, we did nothing, and then the other was if we did everything that the governor said. But I think what's dangerous for me and is people talking about these trajectories and, kind of saying, oh, yeah, we leave those numbers, because I feel like even the most conservative estimate is still something that Guam has never, ever dealt with. The most conservative estimate, the loss of life in the most conservative estimate, we can't be saying, oh, it's not going to be that bad. Only 700 people are. We just can't be saying that.
Yeah.
I mean, that's that's where
even
I
if
feel,
it was 10, it's still
I mean,
terrible.
Yeah, absolutely. And so the thing is that with in this scenario, we look at how things are. Let me back up here and just say that the one thing that we have to really understand is that our actions today don't really reflect in our numbers and our data until about anywhere from 10 to 14 days from now. And that lag time is what gives this big disconnection in terms of our feedback, so to speak, our feedback from our actions. And that's part of the strength of this virus, is that it takes advantage of that lag time. The lag time where you think you don't have it, you've already been exposed, you're already probably you're already shedding the virus before you're even symptomatic. And so it preys on that fact. And so we, as we're supposed to be much smarter than this virus. And so we have to remind ourselves that there's this lag here, and that we have to be still extremely vigilant in what we do. And just because, there's a few cases that come up positive, from the day before or what have you, that's because we did good stuff, 2 weeks ago. And when you see a spike up in cases, that's probably because we relaxed 2 weeks ago.
Right. Yeah.
And I think that's where you were right when you were saying it's the feedback from our actions. And it's really why you guys are stressing and why everyone's stressing that you need to, it's a simple thing. Stay home.
It's so easy. Doc, and I mean, you talk about the roller coaster, 17 positive cases, 1 positive case, 8 positive cases, 1 positive case. That's why I don't think, you can't sit there and say like, oh, man, I want people to be hopeful, but I think that we just need to continue to hunker down. I wanted to ask you something, Doc. With this message of hope and Easter coming up, what I'm really worried about is people hearing that voice that, oh yeah, it's we're doing our part, we're flattening the curve. Let's go get together for Easter.
Yeah.
How worried about that are you guys?
I definitely am. I have this tremendous worry about, that when we as human beings definitely want to, we need some sort of positive reinforcement. And sometimes with that, it comes from our relationship with others and what we want to do to kind of unite and celebrate some of our victories and just, really be. But then that's the whole thing, is that's actually what is the pointed edge of this new reality that we have, and that if we do that, then we're only going to hurt ourselves further, and so that's the tough part here.
Right. The way I want to say it, Doc, is imagine this is a football game, right? I understand that some of the doctors, they want to pat the people of Guam on the back. So if you guys want to think that we just kicked a field goal and spike the ball or whatever, that's fine, but the game is still on.
Yeah, absolutely. And so the last thing you want to do is pick up a fumble recovery and start running back to the other side of the end zone and start celebrating before you even cross the goal line, and then somebody strips the ball right out of your hand before you cross, and so or worse, you just drop the ball, and so that's the thing in this process. And I'll just since we're using football analogies, one of the things that there was especially in the United Kingdom, they actually considered this, when time's running out and you're behind and you're behind by only about 4 points, so to speak, and the offense, the other team has the ball, one thought might be just let them score so you can get the ball back and then score and be able to convert or something along those lines. So the United Kingdom thought about actually just closing everything else except the schools, and let the schools continue. And it was a way saying that the kids are much more healthier. We're seeing that they're more resilient, and that they can actually immediately provide herd immunity for the entire community. The criticism was that you're sacrificing the kids for the betterment of the community. And that was extremely controversial. After Boris Johnson got COVID himself, obviously everything changed after that, and then they retracted that strategy and they changed. But the thing is that we can say kids are resilient, but we just don't know. This virus has so many things about it that is changing and unknown overall.
Okay, so I'm not sure about all this football analogies, but
Come on,
I wanted to. I am a football fan.
Yeah, I know.
But I wanted to get on to the game plan that you guys are going to be talking about tonight with the physicians advisory group and these rapid test kits that Dr. Ho Win was talking about. Can you shed more light on that?
Yeah, absolutely. So so let's just remind everyone that there's mainly two modalities. There's two ways to test. And so we have the PCR, and I'll just say it simply as just the PCR test, and that currently is our gold standard. That's the one that's the best test that we have available, and that's the one that public health is running on a daily basis. That's where we get our results from. And then you have this other test called serology, and basically serology just looks at, and these are where the rapid tests come from. They basically look at is your immune system responding to exposure to the virus? The problem with these two different tests is that the timings of them are completely different. And saying that they're completely correct, first of all, and that let's say they're reporting the correct, what's reality in a certain patient, is that there's a different time. In other words, you could have the virus and it could be picked up on the PCR, but your immune system may not have responded enough for us to be able to test and see if it has. So that's what Dr. Wen was actually trying to explain there, was that there's this differences and overlap. And so what if you get a negative PCR but a positive serology? What if you get a negative serology and a positive PCR? So putting that together is very, very difficult, and it's something that's difficult for even doctors to really grasp and really get a hold of what is interpreting these test results.
That's why we just got to stay home, right, Doc?
Absolutely. Stay home. Safer at home is the key part here. And, one of the things that we've been discussing heavily, and that's kind of going back to this understanding of herd immunity, and that really it's more about the more people that are out, that are allowed to be out are those that have already are immune to the virus, and that's either because they've already had it or because there's a vaccine. Vaccine's not, it's about 12 months away from now. Let's just be realistic about it. And that's even sped up from 18 months, which is usual for a vaccine. Mm-hmm. The herd immunity, and Dr. Wen also pointed out that when you ask him straightforward, the question is, in terms of if you get the virus once, is that good? Are you good? And could you get it again? The answer is we actually don't really know the answer to that question. We think it's going to be typical of other infections, but we can't say that for sure. So that's a major gamble. We start going down that road and just assuming everybody that's had it is definitely immune to it. Mm-hmm. But we'll know more. So those are the things that are going to be discussed during the meeting tonight, and even the meeting before the meeting, and try and figure out Literally, there is, because there's a subcommittee specifically for testing, right. and it's going to be kind of guidelines and a flow chart, I would think, that will be developed so that can help guide people and especially clinicians in how to go about and how do we allocate these resources, and then add into the confusion or the complications that these tests that we're talking about are the ones that at least are coming on Guam first are going to be the non-FDA approved ones, and so how do you deal with that?
Right.
Mm-hmm. I did want to ask about the 31 recoveries, and I was just curious, how long does it take? Like, if I were to get COVID-19, how long does it take for me to get better? If I don't have any comorbidities or anything like that.
Sure. So if you don't have any comorbidities and you feel fine, and the average recovery time is it's considered around 11 days or so, and that's for full recovery. You could start testing negative before that. In terms of the PCR test, I should be very specific about that. That it could start being negative before that, but so about 11 days is what we're seeing. So that's why we're also talking about the 10 to 14 day lag time that we see in some of these numbers here. So that's what is typical, which is why the 14-day quarantine also is why you hear that number a lot.
Okay, Chris, you.
I'm good, Doc. We got Dave Delasola. A lot of people wondering about unemployment. I just want to thank you so much for your time, Doc. And you got our number. Keep us posted.
Absolutely. Yeah, you have a good morning. Thank you for everything you guys do. You guys are a big part of this battle, and we appreciate everything you do.
Thank you,
we
Doc.
appreciate you. Thanks, Doc.
And happy Easter, okay?
Happy Easter. Wash your hands.
Yeah.
He wanted to beat you to it.
There you go, Doc. Thank you.
Okay, bye.
All right. Dr. Doomsday. Dr. Felix Cabrera. Let's get Dave De La Sola. He is our labor director on the line. Good morning, Dave.
Good morning, Chris. How are you doing today?
We're doing good. We're just clear the way for you. Everybody out there in Radio Land and Facebook wondering about the pandemic, unemployment assistance, this is the call that you want to listen to. So, Dave, just real quick, status update.
Okay. A day and a half ago, we got the initial guidance on the outline of the PUA program. It was a release that went nationwide and for Guam and the other islands. So we are starting to pull and starting to put together the shell and putting together a supplemental budget request. We don't have all the information that was in the guidance, and USDOL knows what my questions are that I need to get answered so that we can move forward with estimating my budgets and stuff. We don't have the weekly benefit amount yet.
Right.
And that's the big one that I've been waiting for and fighting for the last couple weeks.
Right, Dave. Can we just clear up, because there is another unemployment assistance program that's coming down from the feds, and that one provides, I believe, $950. But this is not that program, because I keep hearing people say, "Oh, we got to get that." So we're not clear on
that program.
Say again.
It is the same program.
But we're not going to get
that,
$950.
I can't say how much we're going to get. It could be as high as that, or it could be lower. And that's they said that it's under review, and when they have a decision that's made, they will give us what that number is. So I'm guarded for me to say that it's going to be a high or low or anything until the guidance comes and says this is the number. So it could be high as that number, or it could be lower.
Right. Okay.
And I would not be prudent of me to say what I would guess at. I'd have to wait until they gave me that email that said, "Dave, here's Guam's weekly benefit."
Right. Thank you for clearing that up, Dave, because I kept hearing that number and I wasn't sure what to make of it.
Unfortunately, with the guidance that came out, it was written for everybody and mostly the states. Mm-hmm. And the states have their number because it's universal, and it's based on their UI, the unemployment insurance benefits and things like that, which we don't have. That's why Guam number has to be calculated and given.
Right. So, Dave, where are we with the amount of emails you're getting? Can we get some numbers on
that? Sure. We're at.
I'm sorry, we can't hear you, Dave. Dave, we can't hear you.
He's talking. He's telling somebody I need those numbers on the desk. Yeah. Hey, by the way, this is Dave De La Sola, Department of Labor Director, with the very latest on the pandemic unemployment assistance program. If you're just joining us, Dave said he can't give an amount yet. Okay, go ahead, Dave.
8,000. No, I did have the amount. I just got 800 numbers in front of me and things. We're close to 8,000 displaced workers as of yesterday.
And does that include GHRA?
Not all. There's a few that reported in, but I'm trying to get an update from them, and so that we can enter it into our numbers. Right. So this is mainly people that have been and businesses, regular businesses that have been reported into our rapid response email. Okay, so majority do not include hotels.
Okay, yeah, because earlier in the week when we spoke with you, you had told us 12,000 if you added in, like, I think it was 6,000 from furloughed or 6,000 from.
So reduced. Is this 8,000 number, Dave? Is this layoffs, furloughs, and hours reductions?
This is what has been reported to me in my email.
I see.
What the number that I'm going to report as far as for this PUA program that my chief economist has been modeling and putting in is that we're looking at 38,000 claimants.
Oh.
And Dave, when we email that email address, I know that's kind of like been maybe a Rolodex for you in some ways. What information do we need to give? And then, so when we give that information, what happens after that?
Well, we're tabulizing it, and the type of information it all depends on who's calling in, whether it's an employer or employee, because I'm just having both of them, and we're just trying to use that as a way of tracking. There's so much information, Chris, I can't just keep going, but I am asking for the basics, for an employer, your name, your address, what you are, your list of employees that you are furloughing or laying off with some identifying numbers on it, and the date when they've been furloughed. And then the employees that call in, they're basically giving me the opposite: the name of their employer, the date where they were displaced, and the email, the contact information. Mm-hmm. That is just the basics for now. One of the things that I am trying to put in place is a software program that's going to automate the whole PUA, and also automate the employers to input their information per the executive order that was passed a few days ago.
Dave, I got a comment here. What is the time frame to launch the program?
Well, a lot of that has to do, which is beyond my control, and that is when I get the approvals and the information from USDOL. It's hard for me to tell you when there's too many factors that are not within my control. Mm-hmm. What I am doing is chipping away at what I can do. Yesterday we got the guidance a day and a half ago. So within the next day, we put together a semblance of an application form with everything that we thought is required, mm-hmm. and we sent that off to USDOL for them to start to review and to edit or to add. And if I can get that back in some, reasonable amount of time, then I'm hoping within 2 to 3 weeks to get the application all out there.
Okay.
Now that'll be the first step, mm-hmm. and at least give the people a way to start. And that's why yesterday's press release: start gathering your information, start organizing yourself, and ask for the employers to give you, if you haven't given you those letters or whatever, start getting that together, mm-hmm. so that when the application comes out, that you're not scrambling for that. Right. And that's the big message today, is that is what my next milestone is to get the applications out. Okay. And then once the application gets out, then I hope to automate it if I can secure a software vendor, right. and get that automated. So either you fill it out manually or you can fill it out online. And because as we know, our demographics is such a huge sweep, right. from tech savvy to English second language. So that's the milestone that I'm shooting for. Everything else, I still have to put in my supplemental budget request. Right. Yeah. And that is, how much do I think I'm going to need to not only run the program, but as funding for the 38,000 claimants.
We had a comment here, Dave. Yeah. I hope he doesn't say in 2 to 3 weeks again. I heard you say 2 to 3 weeks. Is that still kind of what we're looking at?
I've never said 2 or 3 weeks again. I don't know. I'm very careful when I give timelines, because I try to, like I said, it's hard for me to give a timeline when there's so many variables that are not within my control. I can't tell USDOL, give me the outline of the program. Right. Give me my weekly benefit amount. Answer all my questions when they're designing a program nationwide. Yeah, yeah. And nobody, I understand their frustration when people don't think I do, but I do. I got family, I got friends, all in the same boat, right. and I want to roll this out. But, it's like you trying to give the information if I don't tell you, and right. you're waiting to hear from me. Mm-hmm. I'm in the same boat. But I'm hoping, I am giving you a timeline. But if they don't answer my application and they don't get back to me, then there's nothing I can do. But I can't understand why they wouldn't reasonably give me an answer of here's the application is good, tweak it. The application, remember, is more than just the information. It has attestations on it where you got to say that you're not getting any other benefit, that you are under the perjury or of federal law, that you're not going to do. There's things in there that you have to sign off on.
Are self-employed also eligible, Dave?
Yeah, and that's a great question, because a lot of people are saying, do I qualify? Self-employed people, people that have been laid off, people that have been reduced hours, gig workers, which is a new term for me because I guess I'm not a millennial, but gig workers are covered, and also what's called lacking sufficient work history workers are covered, and people that work on their own, with self-employed, but farmers, craftsmen, people that maybe don't file a tax return, but that manage to crank out a subsistence living, either carvings, Serology, whether it's doing art stuff or doing
cutting grass,
whatever it takes that you do, that you can, number one, you're going to have to self-certify, and most likely get proof from either your customer base or from the mayor. I mean, the guy that gives the cowbell rides, or something like that.
Uncle John?
We have a question from one of our viewers. Can an essential worker decide to not work and comply to lockdown due to a delicate illness, would be able to apply for unemployment?
Okay. I hate to give answers because there's usually a lot more behind it.
Right. Yeah.
What they're saying. But if you're not working, and this is the patent answer, if you're not working and the reason was because of the COVID, then you would most likely qualify. Now, what you can't do is say, oh, I'm going to quit because maybe the benefit is more than what you're working. That is not legal, and that's fraud.
And hours reductions are also covered under this. We had a comment where someone said, what if we had our hours reduced?
And the yes is the basic answer, and the easiest answer to understand is whatever that weekly benefit amount is, if you're making at your reduced hours more than that amount, then you would not get anything. If you're making less, then you will get the difference between the two.
Okay. So as we're
pretty
waiting,
much makes sense, right?
Yeah.
As we're waiting for you to get further and additional guidance from U.S. Department of Labor from what you had submitted.
Even when you say it, I hate hearing it.
But you are asking everybody to get your paperwork in order.
Yeah.
Valid photo ID, passport, copies of the latest paycheck stub, social security number, and a certification letter from their employer. The public health is also running into a similar issue with people trying to tell people not to get out on the road, and they're working with the mayor's office to get certification letters. So what about?
I mean, there are so many different ways of doing it, and right now, mail it. I mean, the mail will get to you within 2 or 3 days. So that's why I'm getting this information out early enough. And those farmers or those Mr. Carabao, you're going to do a self-certifying, but also, if the mayor knows that you do this every time, get something from the mayor that says, yes, Joe Cruz does the Carabao, I can attest to him. And he doesn't necessarily have to file taxes because he barely scrapes enough, or that farmer that barely makes enough that he sells his fruit on the side or sells it to, friends around the neighborhood. Those are the kind of things that you can start working on now, and you can certainly call the mayor up and say, can you write me something and mail it to me at this address? So that's why I'm doing this very early, so that people can start to get their information now without having to panic and drive around and start spreading the virus.
Okay. So just to go over those numbers one more time, you are looking at 8,000 so far displaced that have contacted your office, but that doesn't include the full picture from the Guam Hotel and Restaurant Association, but you are projecting at least 38,000 claimants?
That's what we're going to use to submit our budget request once I get the final number from USDOL.
Dave, can we just fast forward to when the program stood up? People apply, they get the amounts. Who's going to print the checks, and how are we going to handle that? Are we looking that? I know you're a planner. We're looking that far ahead, right?
Yes. The only solution right now is using DOA. Right. But until I get a better feel of everything, but that's how we used to do it back with the DUA program.
Right.
When we had disasters. And now you can see how what is critical is I know there's a large segment that doesn't, but getting your electronic transferring, that would ease the burden of the workload. If I'm cranking out 38,000 checks, that's 38,000 papers, 38,000 envelopes. How do you get on a weekly basis for 38,000 people? So if you have electronic, if you know your banking information, get that together.
Just start getting stuff together. Good advice.
Yes, and that way we can just electronically transfer the money and it hits your bank account immediately versus getting a paper check and then somehow distributing it if we're still a shelter-in-place order. Then it would have to be mailed every week, and that is time that a lot of people don't have.
Have you been working, or have you heard anything from the Legislative Labor Chair, Senator Regina Bisco Lee? Has she, called you about this or anything?
Well, I've been mostly briefing them on my program, keeping them up to date. I did a conference call, Zoom call with all of them, and they've mostly have been nice enough to leave me to work on this program, and I've just been keeping them updates. And of course, they're always saying, if there's anything that they can do to help. So I do want to say the legislature has been very helpful in letting me try to put this program together and not asking too much from me because I'm full, PUA mode.
Right. Yeah, because I know. Are you going to be appearing in emergency session? Have you been notified that there's a possibility?
Called. Most of the things that they're looking at does not have to do with me.
Right.
Well, her bill 30. I'm not Bill 30. Bill 340. It's providing funding for 30,000 families, and it says it's for people who have been displaced.
Right.
Yes, but it's I haven't.
Maybe they're going to use the honor system, Dave.
But that would be not that would probably be more like the stimulus checks for those people.
But I wonder if they're gonna call you and be like, hey, do you got any numbers so that if this does pass and all that stuff, I mean, surely they've got to vet something through labor.
Well, I don't know how this program is.
Probably telecom.
How this program is going to be implemented and run, whether it's through me or Rev and Tax, or that sounds like a Rev and Tax. They are fully aware, and I just hope that the legislature always knows that if they run things through either Rev and Tax or ourselves, then you're pulling resources away from the federal program, and us trying to get that stood up and running as quickly as possible.
I just had one more question for clarification. Sure. You said the 38,000, that's the number of claimants that you're going to be using and for your budget request. Were you talking about to USDOL or are you talking about to the Guam legislature?
To the USDOL.
USDOL.
Okay. This PUA program was passed.
Right, yeah.
Now every state and territory and everybody has got to put together the program and then submit to USDOL. Well, how much do you need and how much do you need to put together the program?
And this is all federal money. This isn't going to be like 100%. we're going to pay up front and then we're going to be reimbursed.
Right.
100%. It is either advance or reimburse. So if we do use local funds, it would be reimbursed quickly.
Right.
Okay, so there is that possibility that local money might need to be used.
We do look at that. Right. Okay. I need it because like when I'm looking at procuring equipment or software or this or that, I've asked the governor if she could set aside local funds so I can just start the procurement process.
Right.
That in itself takes almost a month.
Right. But maybe they could give you some emergency waiver, or there's a lot of waiving going on.
We are waving away as much as you can, but you can't wave away. You need to get the quotes. You need to put them in still, and you need to write it up, and I need to justify those requests.
Right, but you said that 950 was the upper end of how much these checks,
yes.
right? So if you multiply the 38,000 to 950, that would come up to what, 36 million?
No. If you were to go with that magic number, we're looking at over $1 billion.
Oh,
because
so this is in a one-time.
No,
so
this is
then you multiply.
Weekly, we have
Okay.
Gary Hiles doing the spread, and basically you have a high number during a shelter in place. But once that shelter in place is lifted, you'll slowly start to have businesses open up again. Not all, but a lot. The restaurants, this, that. And so that we spread it out between now and December, a modeling that shows, okay, certain businesses after month one will be back, so we can reduce it by 10, 15%. He has on our employment report, which has always been good, he has them breaking out by industry. And of course, the hotels will be the slowest to get back because people, once we get out of this, aren't going to travel on vacation. And the airlines need to come back. They need to get the tourists back. And that is going to be a slow process. So that recovery curve will be very, slant will be very low. And spreading that all out, and then we put in we're waiting for that magic number, that weekly number. And if it was at 950 or 960, we're looking at over $1 billion.
That's why it was a two. Yeah, this is. I mean, hey, they're printing the money over there in D.C., so we'll take it.
Yeah. So that's why that number is critical. And then I need to put in, and you can just imagine. I'm sure the type. I need to collect that money, whether on a manual system, on an automated system. I need to input. You have to have weekly verifications. It's just a monumental task of that many people.
And doing it all while we're supposed to be 6 feet apart from each other and, staying home. So,
and
Dave,
not spreading it.
Yeah,
so
we understand the challenges.
It's a huge undertaking, and we're going to take a shotgun approach by hitting it from every angle, from fully automated to a fully manual, to maybe call in applicants, but a lot of that depends on what USDOL will allow us to accept in an application.
Right. Have you had the congressman doing any heavy lifting or any assistance from him? Because, there's so many of these federal programs, and I'm just wondering if, because he's not on Guam, he opted to stay in D.C., are we getting anything of value out of that, or have you heard anything?
That's not in my lane. My lane is running this program.
Right, yeah.
His lane was to, pass the program.
Right.
Which they did, and then I hope that he's lobbying and making sure that everything is moving as smoothly as can from the Washington side.
Right. Maybe write a letter to USDOL and be like, hey, hurry up a little bit, or
I can tell you that our governor has written several times and has talked several times to the Secretary of Labor, Scalia, trying to get him to ensure that we get the highest dollar amount and that we get this number as quickly as possible.
Okay.
So we're hitting him from the top, and I'm hitting him from the bottom. From my region to all the way up to my chain of command.
Shuffle him, Dave.
At the very top. So, yeah, he's getting hit from both sides.
That's good.
Jamora punch.
1, 2.
Right. Dave, thanks.
And I really appreciate you guys getting the information out to the people and let them know that I will continue to feed you all the information that I know as I get it from USDOL. And I appreciate you guys getting information out and keeping the people calm and getting them prepared.
Right on. Dave.
Thanks, Dave.
Agamas, good luck and happy Easter, Dave.
You too, and have a safe one.
And wash your hands.
Yes, I will.
Okay, there you go. Dave Delasola, Department of Labor.
Yes, somebody was, one of our commenters was asking about the information, the documents that you need that DLWell wants you to start preparing to submit. They want a valid photo ID, passport, copies of the latest paycheck stubs, a social security number, and a certification letter from their employer.
Okay. Any other questions, comments? I really got to use the bathroom. TBH. Sorry, man. But we're going to come back. We're going to deep dive the news on COVID-19. And then we got some people that our listeners want us to try and get a hold of. And we are going to do that right here on Containing COVID. It's KUAM-FM Agotnia. Good morning, Guam.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Just 5 weeks ago, only 9 people in the U.S. had died from the virus. Since then, there's been rapid acceleration. In New York, around 730 people died Tuesday alone, nearly one person every 2 minutes. But there's some good news.
We are beginning to see some flattening of the number of new cases per day in specific metro areas.
One doctor who treats COVID-19 patients inside New York's Mount Sinai Hospital says she's encouraged by the number of patients coming off ventilators.
I feel hopeful because as a critical care physician, this is what we've trained for. We know that this is what we have to do. And we know that we're well equipped to do it.
Hospitals are still trying to find room for all the patients who need treatment. Many are coming here to New York City's Javits Convention Center. It's now an Army field hospital. And last night, the Pentagon announced it will be sending even more beds. Across the country, the elderly at nursing homes are being hit hard. There have been 42 deaths at the Life Care Center in Kirkland, Washington. Another 32 people passed away at the Canterbury Rehabilitation and Healthcare Center in Virginia. And in Los Angeles County, the public health director now says it's appropriate to pull loved ones out of long-term care facilities if you're able to care for them. The mayor of Los Angeles has also ordered all essential workers wear face coverings.
Employers are required to provide these face protections or to reimburse employees for their costs. This applies to workers in grocery stores, drugstores, restaurants, hotels, taxis and rideshare vehicles, and construction sites.
The economic impact has been severe. American Airlines just dropped its LAX to JFK nonstop flights, and Burbank shut down one of its 2 terminals due to lack of...
Yeah, I think one of the things is you go to the 311 and they refer you to the public service. They'll let you know ahead of time what kinds of documents you need to verify. And Linda's here. She could probably add more to it because public welfare is also under her oversight and responsibility. But I think if people are prepared with those documents a little bit ahead of time, they could probably have their applications expedited.
Yes, thank you, Governor. Yes, we have contact numbers, and we've added, as the governor indicated, to the 311. They'll call that number, and then they'll be connected to option 2, which will be for public welfare inquiries. And I'll just give you that number so you can help us to circulate it all around town. It's 735-7237, and that's with the Bureau of Healthcare Financing Administration at the Castle Mall. And we also have 735-7575 or 7576. Which will be the Bureau of Economic, also the Castle Mall, and the Economic Securities is for the SNAP program. And then we also have the Bureau of Economic Securities for the Northern region, which is 735-7488. And again, this SNAP program for the Bureau of Economic Securities at the Southern, you call this number 735-7542. Now, in regards to this, I've already asked Tess Archangel to be very creative with all my staff, so that we don't have them all lining up and crowding the whole public health. What we're doing is we're putting drop boxes So whatever essential information as far as documents that they're going to need, they'll just drop it in the respective drop box. They can also email it, and they can also send it through the mail, the regular mail. Email's a lot faster, as you know. And so our staff will gather all this information, and whatever is missing, again, if you gather all the information that we need, we can process it in one day. And I was assured by my staff that that can be done. However, if you don't have the proper documents, we're also working with the mayor's offices, and they're going to help us as well so that we don't have everybody crowding everywhere. So the mayors can also, we're trying to get them to also accept all these documents, and then we can move these documents to our department, and that would expedite a lot of things. Right now, the biggest challenge that we're facing, and we're working on it, is that we're trying to get a list from the businesses that either closed down or they're furloughed their employees, to get the total number of employees that are on that list of those that have been furloughed or they're not working. And if we can verify that, then that will help us with the application process. Our staff are also in close communication with the Off-Island Food Nutrition Services Program, so we can see, is there any other creativity that we can allow? For example, just have a temporary period of when they can be under the SNAP program. And we're just waiting for that clearance. And if we can get that clearance done, if they can say, okay, we'll cover to a certain period, then we'll right away process those and let them be available for those who are new applicants.
Today, the soldiers and airmen of the Guam National Guard are working hard to fight this.
We got Tomas McGlutney of this over in the CNMI reporting on the latest in the Northern Marianas on COVID-19 coming up. But first, I'll tell you all the ways that you can catch our Containing COVID show. It's, of course, on I-94 FM. That's 93.9 FM on the radio. We're streaming KUAM.com, the KUAM News app. We're also, of course, live on our KUAM News Facebook. Thank you so much to our viewers. And we're streaming on Docomo Channel 10. And then Monday. Right? I'm going to wear my Easter Sunday clothes. Do we all do that? No, I mean, you know.
Let's ask everybody to wear their Easter Sunday clothes on
Monday. Yeah. And
pastels.
Send us some pictures. Yeah, pastels, you know. My mom sent me a nice Easter shirt. But there was a point a couple weeks ago, Bree, where mentally I was all over the place, and I was just struggling with, do I even iron my clothes? I mean, I've been wearing Zori to work every day. You know what I mean?
Wearing my tennis shoes.
Right, and so I think Monday, just for Easter Sunday, to honor, you know, our Lord and Savior, that I'm going to come and I'm going to wear shoes and I'm going to iron something. Yeah, and put gel. Okay, so
Roslyn, better watch out.
Right,
I thought he looked like a popsicle on a stick. I can't wait to hear
till
how
Monday. I might do a sit-up on Saturday. Yeah, look out. 8:23. So what we're going to start doing here is airing the show KUAM TV 11. It's going to be 8 to 10 in the morning. And around 8 o'clock, around this time, we're going to do another deep dive into news. Of course, we do it in the 6 o'clock hour. And so let's get right to that with Sabrina Salas Matanani. Good morning, Bree.
Off day, everybody. Good morning. According to the latest from the Joint Information Center, their latest release was at 9:20 last night. Public Health tested 34 individuals for COVID on Wednesday. 1 tested positive through Public Health and 33 tested negative. Public Health's overall count, though, also includes an additional 2 cases of COVID-19 that have been clinically diagnosed. While those cases have tested negative, they have image findings consistent of COVID, display typical symptoms, and have epidemiological links to previously confirmed cases and thus being treated as COVID-19 cases. The overall count also includes 11 positive cases that were tested by the Naval Health Research Center in San Diego and 1 confirmed positive case through Diagnostic Laboratory Services. So this brings the total number of confirmed cases to 125. Meanwhile, in the CNMI, they have 3 new confirmed COVID-19 cases, bringing the total number of CNMI's total confirmed cases count to 11. As for an update on the USS Theodore Roosevelt, as of today, 79% of the USS Theodore Roosevelt crew have been tested for COVID-19, with 230 positive cases so far. Additionally, 2,037 sailors have tested negative, 1,999 sailors have been moved ashore, and 1,232 are in quarantine hotels. As testing continues, the ship will keep enough sailors on board to sustain essential services and sanitize the ship in port. There have been 0 hospitalizations.
8:25. Thank you so much, Sabrina Salas, Matt Donati, and you talked a little bit about what's happening in the NMI, and so let's go to our CNMI correspondent, Tomas Maglotnia. Good morning, Tomas.
Good morning, Chris and Bree. How are you?
We were talking a lot about the CNMI yesterday, and of course, I was able to ask the governor that question about the furloughs that are going down there. And man, and then just thinking about everything that's you've been reporting on, my heart goes out to the Northern Marianas.
Mm-hmm. Yeah, it's changing times for everyone, and just to provide some updates. In addition to that, yesterday I'm going to be seeing if I can contact Department of Labor and the governor's office to get some numbers with any furloughs or layoffs that might have been affected already. But just to provide more info in the CNMI as of last night, we have 3 new COVID-19 confirmed cases on island, and they were announced by the governor's COVID-19 task force. Of the 3 new cases, as we reported last night, 2 are male, ages 45 and 53, and 1 is female, age 53. The new cases are monitored by The 3 new cases are monitored by medical teams at the designated quarantine location on Saipan, which is Kanoa Resort. And there are now 11 total confirmed cases in the NMI, including those 2 unfortunate deaths. They await the results of 6 specimen right now. And the Commonwealth Healthcare Corporation is also preparing to use a portion of its parking lot to set up that 50-bed field hospital on Navy Hill that they received from the National Stockpile. We also learned yesterday from the hospital CEO, Esther Almunia, that massive testing of members of a faith-based organization, massive screenings have taken place between 400 and 500 of those members who voluntarily offered themselves up for screening, and they continue to be monitored through their texting system and by some of the officials. Munia also confirming on island testing capabilities are potentially available in late April or early May. She, of course, says the ideal situation is for everyone on the island to be tested. And with regards to PPE and staffing, she says that they're able to operate with sufficient supplies for the moment, and no one is being left without a PPE at the hospital, especially after the arrival of the materials. And also overnight, the regional task force released the priority details for testing. And with the exception of a few specimens submitted to the CDC and the State of Hawaii laboratory, the majority of specimens from the CNMI have been tested on Guam. And so those are some of the updates that we learned over the past few days.
Right. Do you have any further update? I know there was a letter that the governor issued regarding furloughs of government employees there. And I believe a list was supposed to be submitted yesterday to the governor's office. Has there been any other information on that?
Yeah, I'm working to get that information today from the governor's office and potentially from, the different departments themselves who obviously offered these lists up. I do know that they were, some were delivered. Obviously they had to, and we hope to get those numbers, and some also hear from, the experiences as well, because these are real people we're talking about.
Yeah.
So, but I don't have that right now. So.
Okay. Well, just for clarification, are we looking at reducing the government in half? Or is it just the budget by half?
It wasn't exactly clear, but I know that I'm trying to pull up the release.
I'm just going off of memory.
The release says reducing the cost. So, you would. I don't know how that translates to necessarily the amount of personnel, but
right. But I think the main takeaway is that a lot of people are going to lose their jobs.
Yeah.
Yes, that is the case. I listened to the previous interview right before me, and it's interesting to see how things like the PUA and CARES Act are actually in effect. I'm working to get our U.S. delegate, our Congressman Kilili, to do an interview with KUAM to kind of draw this out as especially to what it means specifically to the CNMI. So.
Man, Tomas, I'm a big fan of Khalili. If you could arrange that, we'll clear the way. We'll give him all the time he wants. The same goes for our congressman.
Right.
Yeah, I'm going to reach out to him today. But if any of our staff are listening in, we'd love to hear from him. I know he's been releasing his own press releases practically daily. But yes, it would be nice for people to hear from him directly. I know he's stuck in DC now because of the travel. So he's definitely there putting in work.
Man, but he's definitely keeping busy, and I think he kind of sets the example for the region of what a congressman and how a congressman should communicate with all of the constituents, not just the select few.
Yeah, he's open to the media, so I know he's going to be willing to find time for the interview with the time difference. So.
Yeah. All right. Well, thank you so much, Tomas. If you can hook that up with that interview, let us know. And whether you do it over there or we do it, we'll definitely get it done.
For sure. And, just encouraging everyone, Esther Munya definitely provided some really good information yesterday. That interview is streaming live on Facebook right now. So
yes, and there were thousands of people that watched that interview. So thank you. I really appreciate it.
Thank you, Tomas.
Thanks.
All right. There you go. Tomas Maglotnia, our man in the CNMI. And let's go a little more local now with our KUAM News reporter, Adriana Cotera. Good morning, Adriana.
Good morning. Hi. Hi, Chris. Hi, Bree.
Hi.
So
how are you guys doing?
We're doing okay. We washed our hands. We're masked up.
Actually, I forgot mine in the
you better go get your mask. Yeah, I'll give you time. Go ahead.
Joe's going to go get it.
Okay. So, Adriana, you had busted a story out yesterday. This was quite a story. Department of Corrections and COVID-19. Can you just give us a general update on everything that you reported on?
Yeah, of course. So, I had spoken with, you guys actually spoke with Major Anton again in the morning, and then I had reached out again after we received an anonymous statement from a family member of someone that is incarcerated. And they had just mentioned that now that they can't do any visits, on-site visits, and meeting with no family members can go and see any of the detainees or any of the inmates right now, and so they can't receive any items from family members. And a lot of family members are hearing from the different inmates and detainees that they're not getting the necessary hygiene or cleaning solutions or any supplies that they need, especially during the time of a pandemic. And as we know, one of the DOC recruits recently did test positive for the virus. So now they are worrisome, as they have every right to be.
Right.
And so just in speaking with Major, again, he had said that as of right now, the remaining 38 recruits that they are doing on-the-job, they were in the on-the-job training stage of their cycle. They are all self-quarantining at home, and as far as he knows, they did not have any contact with the one recruit who had tested positive.
I really got to qualify that, Adriana, because we all know how contagious this virus is. We all know that you can continue to spread it without having symptoms. And in speaking with a couple of the inmates, they know who the cadet is, and they say that he was, at the Dome, and so that's what I think is. While DOC is saying, everyone masked up, they gloved up, or whatever, we just know that with this insidious virus, it'll take any chance it can to go from one person to another.
Oh, of course, and gloves don't even just do it at the end of the day at this point. So, and this one recruit, he was in the Dome area, which it houses the different parole violators, court paroles, and local detainees. And I had asked Major Evans for I was wondering how many different inmates are in that area. Just wondering, there's 3 separate units, and each have about 30, close to 30, I'd say, nearly about 30 inmates within the different units in the Dome area. So that's quite a few, of course. That's close to 30, 60. I don't really know numbers, but close to 100, right? So different inmates and detainees, and then the inmates are worried, and they are reaching out to their family members, and we're having their family members reach out to us and provide us anonymous statements. And even so, imagine even an outbreak within the prison, it would spread very, very fast. So I asked him about any mitigation efforts that are underway, and he had said as of right now they just have sent the recruits home to self-quarantine, and that the inmates and detainees, that no one has showed any symptoms yet, but they do have GMH. I did that on-site visit about a month ago, and they do have I think 2 GMH nurses there, and then if someone were to present symptoms, they do send them to the hospital, and they would have they would receive treatment. But he says as of right now there isn't anyone with symptoms, but we don't know what could come up in the next couple weeks.
Right. And so they're also saying that this isn't impacting the operations. Is that just something they're saying to, so if the inmates get wind of it, they're covered, or is it actually true?
He says that they're not. So, I mean, I don't know if it's true or not, but he says it isn't impacting the operations as of right now. And I do know early on that they did implement at DOC, on May 16th, because I had ran that first coverage asking what the security measures were in order to prevent
on March 16th. Yeah.
March. Oh yeah. Sorry. So in March, and they put a 30-day. They made it a 30-day lockdown. So it wasn't just while government of Guam said all government agencies are 2 weeks. That was the initial time frame. They said 30 days off the bat. So they've been going since about March 16th. So they're not going until the end of the month, but that could be extended at this point then.
I know you had interviewed Major again early on a couple of weeks ago when we first started looking into what preparations and mitigation efforts were underway at DOC to prepare for something like this to occur. And so if you can take us back to that and just let me know, what were their plans and what were they doing?
So they did not, in order to secure anything like this to happen, they decided to not allow any visitations from any even legal visitations, as well as any family members or any friends, anyone coming in and out of the prison. They also said that anyone because they still have court cases happening and there's still people being arrested, right? So they said that they have to go through the Hagatnia facilities prior, and that they're doing screening and testing, or not. I don't want to say testing because it's not. They're not using a test kit, but they're checking them. They're screening them, pre-screening them, and checking to see if any inmates or detainees have any symptoms in line with the coronavirus. So for fever and things along those lines, and then they would be transferred. However, if someone is, then they have an isolation area already designated in the facility for them.
All right. Let's move over. Oh, go ahead.
Oh, sorry. But yeah, that was their initial. Those were their initial protocol they followed. But I'm sure now that they do have the one case, it's something I'll definitely have to follow up on and ask what further mitigation efforts are going to be taken in order to prevent an outbreak there.
Mm-hmm. Right. What about let's move over to the Department of Education, because the Guam Education Board had a meeting yesterday. What can you tell us about that?
Mm-hmm. So they did meet yesterday. It was a special meeting in order to they needed to pass the resolution that would suspend certain board policies that allow for the school year to legally be able to end early. So that means addressing graduation requirements, grading, and promotion. So I had the meeting had just ended right before news time, and I was trying to go over it really quickly. And in that, I was speaking with Guam Education Board, the Vice Chair Mark Mendiola, and he said that the board fully supported Superintendent John Fernandez's decision to close down the schools, and they did unanimously pass the resolution that would suspend these certain board policies. The only thing that they're waiting on right now is the legislation that Vice Speaker Serena Nelson, who's the chair for the Committee on Education, she introduced about, I think it was last week. And this measure would allow them to also suspend the 75-hour service learning requirement that's for graduating seniors. So they essentially have to have these hours placed and put in, and then they can graduate, and it's 75 hours. So once that legislation moves further, then they plan to have the Guam Education Board will be meeting again in order to address that. So that's still a pending issue there, but otherwise they did pass the resolution, and schools are closed. And Mark Mendiola just had told me that they were very happy with the Department of Education employees and how they navigated through the process and providing a solution to this pandemic. And even when there weren't any when it came to the grading and the promotion and what was designated within the proposal, there were not any. No one went against it, so there weren't any objections to that.
Okay. Thanks a lot, Adriana. I really appreciate all your hard work.
Well, thank you. I appreciate you guys. I feel very proud to be part of this team right now. And everything that we're doing,
man, honest, I was just thinking last night as I lay my purple aura down to sleep that we've got a really kick-ass team, and we're just out here, and everybody stepped up, top to bottom, and you know what? It really is because we're inspired by what we see out there and how everybody who's keeping this island up and running, who's fighting on the front lines of COVID-19. It's inspiring to see that, suck it up, Buttercup. A lot of people are sacrificing things, but, they're out there and they're really excelling. I mean, it's one thing to go out there and do your job, but people are really stepping up on this. I want to shout out Inarahan Middle School, home of the Warriors. I got a soft spot. We were going to do the Chiefs Day this year, but unfortunately, a casualty of COVID. But you follow them on Instagram, you just IMS. They're doing this little thing where they're making masks, and they had a little video of the librarian. So just little things like that from these doctors to these nurses who are responding, and of course all the public health team. I was thinking, Bree, a group of public health people maybe don't get enough congrats and thank yous. The surveillance team. These guys, they're going out and they're tracking and tracing, trace investigating a lot of these cases. So when we talk about COVID heroes, I think the governor hit it on the head at a press conference a couple days ago. She said there's a lot of COVID heroes because everybody is just really stepping up.
I wanted to give a shout out to the University of Guam. They held a live stream telethon last night, and for 2 hours, right, Jace? It was just so...
It went even longer than that. I checked the stream length this morning, and it was almost 3. I think they started a little bit early, which is not a bad thing, and then they went a little bit late. But I wanted to ask this, and I wanted to ask it at the appropriate time, but did you guys actually see, our friends at UOG, they lined up, like this whole gallery, and UOG certainly has no shortage of talent. Did you guys see the musical performances that they had?
Not all of them, no.
They had, I believe it was the UOG, the Laddie Tones, because I think I saw Dr. Randall Johnson was in there.
Oh, yeah.
They did it over Zoom, and there were 18 people at the same time.
We've got to get that recorded.
And it was a cappella, and it was synchronized, it was syncopated and everything like that. It was amazing. And you saw, just the way they presented it. You saw the whole, the matrix or the grid of like everybody playing their parts. There was one girl who's, she had her puppy in her hand, and some guy was like,
so cool.
Some guy was like lying down on the couch and everything, but everybody was joining in unison and in song, and it was unbelievable.
Awesome.
Wow. Watch that.
Yeah.
Syncopated.
Wow.
Syncopated.
Thanks,
Thanks. $5 word right there.
Yeah. Well, speaking of sync, wash your hands in the sink.
Still hear me?
Yeah,
we can hear you.
Yeah, you're still there.
I was like, I think I'm still here, but no, I was just going to say if there's someone I wanted to shout out, which I was thinking as I'm about to do the ins and out recordings for Live Local Friday, right? And our Stay Home edition that's coming up, and I was like, the people I really want to shout out are a lot of the parents here. So you, Bree, and Chris, because I couldn't imagine having to, I'm not a mother, but having kids.
Hey, if you're going to shout out the parents, Adriana, you got to shout out the guardians, the Ninos, the Ninas.
Yeah, the guardians, everyone who has
the nanas.
Yes,
the tatas.
Exactly. The grandparents too. Everyone else who has loved ones that they're watching over right now, because I couldn't imagine, not only trying to, fight for your own life, but then fight for others and protect them during this time. So, shout out to all the guardians, all the parents, all the grandparents, everyone watching over and trying to keep themselves and others healthy.
Okay. Hey, thank you, Adriana, and we're really looking forward to what you're tracking today with your reporting.
All right.
Okay.
Well, you guys have a good morning. I'll be listening in too.
Wash your hands.
All right. Bye.
Bye. There you go, Adriana Cotero.
And I got to give it up to her because she lives on Guam, but her family they live off island.
Right.
And so she's pretty much here. She's not alone because we're here for her if she ever needs anything. So I really appreciate. I know that's a lot of stress. My parents, they live off island, and so I don't get to see them or take care of them. But we communicate like how people are communicating these days over FaceTime, over Zoom. And so
I was going to say, Adriana just told me the other day that she goes, I've met so many people maybe in the last like 2 weeks over Zoom that I might meet normally in the field when she's reporting a regular beat. She interviewed like a very good friend of ours, Dr. Juan Flores,
right?
Former DOE superintendent, and I was like, I made the introductions because I was doing the tech stuff in the background. I was like, yeah, Juan's a really good guy, and she was like, wow, it's really good to meet you. She's like, I probably never would have done this in real life with my normal responsibilities. I'd be in court right now. But she's like, man, I'm just meeting so many amazing people without actually physically meeting them.
Right.
That's how you like it, right?
Yeah. Social distancing is no problem for me.
Yeah, he's been doing it his whole life.
Yeah.
8:45. That's our man, Jason Solis. And just to shout out the behind-the-scenes team here, we got Jason Solis running, the tech end and checking the comments and responding, hopefully real time. And then we have Joe Sir, who is from our KUAM Photog team. Obviously, a lot of us are cross-training and learning how to do different things. So thank you guys so much. Up front, of course, Sabrina Solis Matanani. My name's Chris Barnett. We're going to take a break. This is Containing COVID. Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Hapade everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together, this war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row, Row, Row Your Boat or Happy Birthday a couple of times, but make sure you get everything. Get the top of your palm, your hands, the bottom, your thumbs, in between your fingers, and you can even use just regular soap and water. But just wanted to remind you that we're all in this together. We're going to get through this. And finally, stay home. That's very, very important. Nestor Lecanto for KUAM News.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Baby, I'm just trying to let you know how I feel. You have no idea. I always think of you. You're on my mind like wind blowing
Right on.
through trees, and when I hold you close, there's
My
no
party, the late Savage K, was Gone with the Wind. 8:52. Containing COVID, the KUAM news takeover of Guam's favorite, and let's do a little call here. You know, we put it in the comments.
You put it in the comments.
I did, and it's somebody that we've been asking about. We've been a lot of, and not just us, and people have noticed. A lot of people have noticed that we haven't seen the Lieutenant Governor Josh Tenorio.
I gotta say, when you posted Lieutenant Governor John Manoni,
I'm just saying, like, I mean, we're and it is what it is, and I just feel like it's reached a point where it's like Waldo. Where in the world is the lieutenant governor? And we're not even hating. I mean, honestly, dude, like, people elected you into office because they believed in you, and people continue to believe in Lieutenant Governor Josh Tenorio, and there is a lot of people want to hear from him because he's an eloquent speaker. You know what I mean? He's very quick on his feet.
Yeah.
And I think it's
calming,
just reached a point where it's
reassuring.
weird.
Yeah.
It's totally weird.
He was attending the press conferences at the beginning. And then I'm not sure what happened. Maybe he is in his office working on how we're going to handle the homeless population situation.
Right. And so we'll just give him a call here and see if he picks up.
This voicemail box is full and cannot receive messages. Goodbye.
All right, so we did try giving the
That's
lieutenant
you know,
governor.
and honestly, I'm not a jerk. Well, okay, sometimes I can be, but I did make a call offline to him first, just as a courtesy. But I think, man, it's reached a point where I don't even know what to say, and people are wondering. I called a friend of mine who's works in the COVID response, and they don't even know what's going on. And you know, and when I did that video last weekend, I'm gonna be honest with you guys. I told you the governor had reached out to me. She was very disappointed in it. You know, I gave her my side of it, which I don't run and hide. I mean, if you got an issue with something I say, I want to talk about it. And she had said, why did I single out the lieutenant governor? Which I don't think I'm not singling out anybody. He's the lieutenant governor of Guam. I mean, and it's not even us wondering. I mean, it's reached a point where, like, we see it in the comments. We don't see him at the press conference, and all we can do is speculate. I mean, is he okay? And that's really where I'm at now.
Yeah.
Like, are you okay, Josh? Are you okay, LT?
And the thing is, you know, Josh, he's always been very accessible. If you see him out in the field, you just you can go up to him, you can talk to him. He's very approachable and doesn't shy away.
Right.
When you have a question for him. And so yeah, you're right. It is a little bit concerning, and I do hope he's okay.
Yeah.
I did see a video of him yesterday, I believe it was on social media. Just encouraging people to donate to the University of Guam's live telethon.
That's good.
So he sounded fine. He seemed okay.
Okay.
But you know, I don't know when that video was recorded. So
Oh man, now this is where all the speculation comes in, and
I'm sure he's fine. I'm sure he's fine.
But I mean, you know, Messiah call. I mean, and I reached out to him after that video, and I know I'm pretty sure his feelings were hurt by it. You know, sorry kind of. But I reached
Hey,
out.
this
to
isn't just
this is big boy territory, right? We're all stepping up and really. You got to fill the void. I mean, Lieutenant Governor, it's not just Governor Lulian Guerrero that we elected. It's, Lieutenant Governor Josh Honore. And I don't even know why the hell I'm explaining this to you guys. It's just common sense, right? I mean, maybe he's with Senator Joe St. Augustine.
All right. Okay, let's just move on.
Okay.
All right. So I know a lot of people have been, I wanted to give you these numbers again because people have been wondering about public assistance. And so public health, their phone numbers, if you want to call, it's 735-7327, 735-7576, or 7575. Linda DeNorsi, the director over at Public Health, she mentioned that she is working with the village mayors to get them the documents that they need if you're going to apply, because there's a whole list of things that you need to have before you even apply for the public assistance programs that they have, and that's cash assistance, MIP, Medicaid, and food stamps. Also, the Guam Department of Labor, if you are going to apply for the PUA, the PUA, the Public Pandemic Unemployment Assistance Program, Department of Labor Director David Della Sola, earlier in our interview with him, which you can also find later on our YouTube page, he is still waiting for official guidance. He received some, but not everything, from the U.S. Department of Labor, and that's where he said is the bottleneck. But in the interim, he's asking for you to start getting all of your paperwork, all of your documents ready. That includes valid photo ID, passport, copies of the latest paycheck stub, social security number, and a certification letter from your employer. For questions about any of the things that I just mentioned, just give 311 a call, and they can provide you with additional information. In the meantime, taking a look at national headlines, the CDC is expected to publish new guidelines to make it easier for some workers in critical jobs to return to work. And the Trump administration is asking for more money for small businesses. Skylar Henry reports from the White House.
The CDC is expected to change its guidelines for workers in critical jobs of the coronavirus.
If you're in a work situation where you have to be, there'll be a series of recommendations that if you had a significant exposure, of what specifically to do, and if you've had a less exposure, what to do.
Under the anticipated new guidance, people who are exposed to an infected person would be allowed back on the job if they're asymptomatic, test their temperature twice a day, and wear a face mask.
It's a very important piece because it looks at degree of exposure and really making it clear that exposure occurs within 6 feet for more than 15 minutes.
Vice President Mike Pence is holding calls with both Republicans and Democrats in the House today to discuss the administration's response to COVID-19. The administration is asking Congress for an additional $250 billion this week for loans to small businesses through the very popular Paycheck Protection Program.
This is much needed support, and we want to make sure that every single small business can participate.
Meantime, President Trump is shifting blame for the spread of the coronavirus to the World Health Organization, saying it should have provided better warnings.
They call it wrong. They missed the call.
The president is threatening to pull U.S. funding from the UN agency. The organization labeled coronavirus a global health emergency in January. Skylar Henry, CBS News, the White House.
Again, if you're just joining us, there is now 125 confirmed cases of COVID-19 on Guam. There are 31 recoveries and 4 deaths. In the CNMI, the count now stands at 11. And for the USS Theodore Roosevelt, 2,037 sailors have tested negative, while 230 have tested positive. 1,999 sailors have moved ashore, and 1,232 are now in quarantine at our local hotels. As for the Archdiocese of Agana, they are announcing that Father Jeffson Nicholas, the Vicar General, has completed his 14-day period of self-quarantine and has received clearance from the Department of Public Health.
Oh, there you go, 8:59. Coming up, we're going to get Father Richard Kidd. Remember, it is Holy Week, okay? And I dropped that old malfunction, Chelowitz Holy Week, on WhatsApp.
And yeah, my daughter's even, like, she did a whole thing on, what is it, TikTok?
Yeah.
That was hilarious.
It was, and I want to shout out Ty and Vic, because it's pretty cool that, there's just so many memories and nostalgia attached to all that malfunction stuff, and I see people are kind of, passing it around, and I wanted to put that one out in Holy Week, so I put it in a couple of our chats, and it just went all around WhatsApp. And it's just funny because it is Holy Week. And,
it is.
And we kind of, I'm not saying we're forgetting it. We had a good call with Father Paul. But, man, it's definitely something else to go through Holy Week without being able to go to the Masses, which is why we kind of do our part. We partnered with the Archdiocese to bring the Masses to you.
That's right. And we have Masses that we are streaming online. Right, Jace?
Absolutely. So we do the Masses every single day, and especially because it is Holy Week, every day at 12:10. The Masses will show. Now, I know there was a little bit of concern yesterday because we are also putting the Masses on TV. Yesterday, there was a little bit of a connection issue with the Archdiocese's feed right there because they're streaming their stuff just like us.
Yeah.
Their stuff looks really, really great. We've been able to work out something where we can get it to you quickly and everything like that. But they're doing it on iPhones just like we are. So I know some people were saying, how come the Mass cut off in the consecration? It was a technical issue. They worked to rectify that and everything. Rectified, of all the words.
I know my auntie called me. What's wrong with the Mass? I was starting to kneel. I felt so bad. I was like, wait, what's up with the Mass?
No, you said she was actually kneeling, right?
Yeah.
And that's the one thing we want to actually talk about again, because it is such a wonderful thing, and you see people that have never used Facebook before. My mother among them, right? So many people are saying that's just for tech nerds, or it's a young person thing. So many people are saying I can go here, I can pray the rosary, I can participate in these Masses, and there is a sense of community. You see all these people from all over the world praying together, doing the emojis, they're participating in the readings, which we put the link up for every single day for the Mass. So every day at 12:10 we have the Mass, we share it from the Archdiocese, and especially because Sunday, of course, we will have the Easter Mass carried live on KUM TV 8, TV 11, and worldwide from the Dulce de Nombre Cathedral de Basilica. And again, it took me 15 years to be able to say that right on the news, doing that every single night. I nailed it this time. But
you try saying that 5 times fast.
Yeah, we are gonna have the Easter Sunday Mass live on all of our platforms on Sunday.
Right. Remember, we're all wearing our Easter Sunday clothes Monday.
What's your favorite pastel shade?
I like a little gray and pink. I know gray's not a pastel, but I don't know. I think pastels look good.
Okay.
Don't get me started because I'm not the best dresser.
I've got a nice pastel purple that I'm going to wear. No, you came up with the concept partner, so all of us we're all going to wear our Easter best on Monday.
Right.
For Monday show.
And eat egg salad.
Yeah.
And eat eggs. You're bringing it right.
Yeah. No, in all seriousness, we spoke to a bunch of doctors, and most of them are saying that we're doing our part, and we got to keep doing our part. And there's reason to be hopeful, but what we're worried about is don't go into this weekend thinking, oh wow, it's a reason to be hopeful. Let's go. Let's have our Easter gathering. No. I'm sorry. There's going to be other Easters, right? Everybody around the world is having the same messed up Easter we are. Okay. 903. You talked earlier about first of all, I want to drop this here. We talked with Major Tom from the Salvation Army, and they're doing things because he has said that they have just been inundated, flooded. Same with the Catholic social services, with people on our island who they just don't have enough to eat. There's not enough to eat. They're trying to get grab and go meals. DOE's doing their part, really doing their part. I feel like DOE's picking up the slack for the rest of the government of Guam.
Not just, DOE, Salvation Army, all of them are.
I mean, in terms of helping those people who really need that help right now. And this is an example of how we could mobilize the government of Guam. They didn't wait till now to figure out how to do things. Immediately after they called for the government-wide shutdown on March 16th, the superintendent and his team, they started working on how to get these meals out to people because that was the first thing they thought about. We provide meals for kids who would otherwise go hungry because Guam is so poor. We are so poor on our island that every single child who goes to public school gets a free breakfast and a free lunch.
Yeah, I just wanted to answer one of our viewers' questions. They're saying that the number 311 is still not working. How can I call DOL? So I'm just going to give you the number that's on their release for their office, which is 475-7044, 475-7044, or 475-7036. That's the number that I have on their press release. So I'm not sure what's up with 311, but
I think what's up is everybody on Guam is calling it, you know.
Mm-hmm.
I mean, they probably crashed that number already. Every other word out of the press conference is call 311, call 311. So
okay, well, you know what? On a technical end, I know when we were all basically in the waiting room for yesterday's governor's press briefing, there were some people, and I just jumped in there, and Chris and I were doing like what we refer to as like a Reddit AMA, the Ask Me Anything, and so we were taking questions from everybody who was getting ready for the press briefing, and some people were saying I can't get through on the 311, and you actually had some of the network people and the system administrators from the different telecom carriers, and they were saying it works on our system. Yeah, I mean, there's a lot of people calling right now, obviously, so the system is working. You just have to keep trying, and like patience obviously is appreciated, but the technical people are saying the lines do work.
Okay.
So
Well, there you go.
just keep trying to call 311.
There you go.
If you want to call for public assistance with public health, I want to give those numbers again: 735-7327, 735-7575, and 735-7576. That's the number for public health if you are wanting to apply for public assistance.
And we were talking about assistance. Let's go over to the phones where we have Asia Ramos of West Care, and they've got a few different programs that we wanted to bring her on to talk about. Good morning.
Good morning.
Hi, Asia.
First of all,
Hi.
I know that you guys are in the work of providing services for people who are at risk and who need it most, but I want to just start by asking, how are you doing?
We're hanging in there like the rest of the island, trying to take good care of the clients who are in need of services, those who are most vulnerable in our community, and of course our staff and their families, keeping them all safe and up to date with the latest information.
And we want to get some information out to the people. I saw you guys have put out a release here. And let's just start with the program that offers assistance to at risk of being homeless and homeless veterans.
Yeah. So thank you for responding to that. We feel it's really important that people are still aware that help is available out there. In West Care, we have a variety of services targeting all sorts of different populations, including youth, couples, families, and specifically right now we're talking about our veteran community. We have a program called the Supportive Service for Veteran Families, and that is really targeting the veterans who are most vulnerable out there. We work with veterans who are homeless, taking them from a housing crisis to housing stability, and we realize that during this time, these services are probably more needed more than ever. We are able to help them with housing stability by providing temporary financial assistance to cover the cost of emergency shelter, rent, and utilities. And more importantly than that, we help them with sustainable options past our services. So they get to work with one of our staff with coming up with plans to help them, whether it's vocational rehab, connecting with medical providers, mental health counselors, just doing more of a holistic approach to ensure that that housing crisis is stable and that they can sustain that housing as we exit from their lives.
Mm-hmm.
In addition to that, you guys did mention about the food pantry and how nonprofits are becoming very overwhelmed with requests. We definitely have seen an impact in ours. So we have a food pantry available to veterans, and they do not have to be homeless. And we realize that during this time of being on quarantine and lockdown with families and people losing income, that the need for food and sustaining, especially the kids who, depended on those meals while they were in school, are now at home with the family. And oftentimes, it's Nana and Tata are there and everybody's living together. So we do have a veterans food pantry, and we have seen definitely an increase in the utilization of that. But we do still have availability of support with food, and we want to let the community know that this is available to those veterans who are in need.
Mm-hmm. And how does that system work? Is it similar to like the grab and go with GDOE? Do they come to your office and just pick it up and leave?
At this point, we've tried to make barriers as reduced as possible to accessing and also ensure a level of safety where we can be able to have measures in place where we're controlling any sort of, social distancing that might occur and transmission of, goods from one person to the other. So we've actually mobilized our food pantry, which we found has been pretty helpful in getting people, who might be at the most risk, who might not be able to access transportation as easily because they can't afford bus passes. So currently we're mobilizing our food pantry wherein we work with the person who calls in, figure out their household size, what their needs are, and then we have a dedicated transportation driver going out and dropping those packs of food to the families who are in need. We also are able to do by appointment only in our office because we're really trying to limit the in and out of the office for everybody's safety, and that's available as well.
So how many people are we talking about? How many homeless veterans and veterans that are in need of this sort of assistance are we talking? Because you said you've been seeing, excuse me, an increase.
Specifically in the food pantry, because you don't have to be homeless to qualify for that. And so we see veterans who have a stable home, but perhaps have had a reduced amount of working hours or no longer have a job, or who are just low income and dependent again on, kids going to school. So on average, I would say per week, we've had 4 to 5 requests for the food pantry, which is an uptick for us. Where when we were having our operating hours, people could walk in or contact us for food pantry, and that probably was around once or twice per week.
Right. But Asia, I was talking with Christine from what I know you know Christine Cruz, also from West Care yesterday, and I think what Bree's trying to get to the bottom of is the affected population, and we don't have a firm number on that, but she did tell me that over, I guess, the last few years, you guys have been able to assist, I think, almost 500 at-risk or homeless veterans. So there definitely is a population out there, right?
Oh, absolutely, absolutely. And in terms of our numbers, we on average serve about 75 homeless veterans per year. And so, over the course of years that we've been in existence, we've hit about that number that Christina has indicated. But those veterans that we're talking about are not just those veterans who you might see on the side of the street or living in a park or, under a bridge or in an abandoned shelter. What we're also looking at, and where our numbers are much higher, are in those who are transient from home to home. They might be living, with family, and sort of those dynamics kind of run out and they're off somewhere else, or those who are facing eviction, who have lost their jobs or who are in a very, fixed income and can no longer afford like a rent increase. And so those are by much greater numbers. What we've seen are those veterans who are at risk of homelessness or are, facing eviction and having to move out. So those are typically the types of veterans that we serve.
Is there an ethnic breakdown?
We do take some demographics as part of our coordination with Guam Housing Coalition. We have, there's a coordinated single point of entry, and we do take data on that. I don't have the numbers for you right now, Chris, but it's that's something that we could generate.
It's a real problem because I know, the last couple of years that people talk about homeless veterans, and a lot of times they're talking about that issue in the States, but it's something that we're living with, and we have been living with this for several years.
Oh, absolutely, absolutely. And I think, it's hard to see our veterans out there who are struggling, and, we're just fortunate to be able to enter their lives and really see a difference when they're in a stable housing and they're able to get back on their feet and, have a lot of successes wherein they feel more comfortable and those strategies are sustained.
Okay, how about, I know you got a few other programs there. Maybe if you could just run through the ones that are up and running and, who they're targeted to and what type of, services you guys offer.
Yeah. So as with most companies, we've moved to telehealth. And we've gotten really creative in what we're doing. So excited to share some of those strategies. We have a healthy relationships program for couples. And this is an invitation to all couples who are at home together who might be kind of,
tired of each other already?
Yeah, tired.
I'm getting that a lot.
Well, Chris, we'll sign you up. Looking
no, from other people.
They're looking for something to sort of break the monotony, trying to do something different now they have all this time. We're offering virtual workshops focused on healthy relationships, and it's a pretty fun program. It's based on science where you're learning about communication skills, doing fun, talking about how important it is to keep fun in your relationship and how to do that. So that's one of the programs that is currently still enrolling and is actively participating in our community. We also have a counseling program. It's called Uplift Counseling Services. We service those who are insured at this time, and we provide telehealth services either through the phone or over video conference. And so those who might be struggling with what's happening out there in the community, with anxiety levels are definitely increasing, as is social isolation. And you know how important it is in our culture to be connecting with all our family and getting together. That really helps us. So that might be a hard transition for people. So that's our Uplift Counseling Services. We also have a Drug-Free Coalition, and this is a new program for us, but I think it's something that the community would love. Is we're focusing on reducing drug use and abuse amongst youth. That includes marijuana, alcohol, and tobacco. And it really is our community coming together in a coalition to focus on Dedido specifically, because we know that that is a hot spot in a highly populated village that could use some intervention. And right now we're rolling out a social media campaign for National Drug and Alcohol Fact Week, and it's a part of a national campaign. So you'll see Guam in there with some of those other communities who are pushing this out. It's called Shatter the Myth. So you can find that on our social media to find out more information about facts for youth about drug use and abuse. And then we also have virtual classes for our youth program, Project Isata, and that's where we're working with youth to teach them refusal skills, how to make good choices, and just general leadership skills. And actually what we've done with that program is we partnered up with DOE. And so we're going direct to parents to saying, hey, we know that there's a need for, positive activities with your youth. So if you have the ability, and we know that some may and some will, but we're trying to capture as many as possible, we're offering virtual classes where we're taking those workshops directly to homes and with parent involvement to keep those kids engaged in something positive.
All right, thank you so much, Asia.
Man,
that's a lot of information.
Hey, I want to give you guys. I want to give you a hand, and all the other NPOs. I mean, there's just so many that running down from Catholic Social Services to Salvation Army to ISA Psychological Services over the University of Guam to Guam Behavioral Health. I know I'm going to forget a whole lot of people. I'm sorry. You know, you're in my heart. You're in my thoughts, and we know that you guys are doing great work. And man, the island is hurting. So I think it's great to see you guys stepping up.
Yeah. Well, thank you for giving us the opportunity. We are here for our community. We are just as invested in us getting through this together and showing how resilient we are here on our island of Guam.
Thank you so much, Asia, and God bless you. Have a happy Easter.
Stay safe.
You too. Thank you.
And wash your hands, okay?
I will.
Okay,
and
thank
stay
you.
Home.
Okay, yeah, stay home.
Mask
stay
up.
home. Mask up. 919. Guam's favorite containing COVID. I mean, I just had to read this comment I had gotten from a port. I put it up on the Facebook feed, and I had got a response from Port GM. And also, man, I just got there's a lot going on here. Complaints about the 311 line, right? People are saying that it's not working. They're trying to call Department of Labor. Well, I got a WhatsApp here from Hannah Cho, who is the PIO for Department of Labor. She writes here, can you please announce that 311 is working? We're getting so many phone calls, and there's only 3 staff from Department of Labor answering option 6. We're all on the phone all day, Monday to Friday, 8 to 5. And so this is, again, where we talk about the execution, the logistical efforts that go on behind the scenes. We need to activate more staff. I don't think that the government and the governor is anticipating how many people need assistance here. I mean, I don't want to say they're out of touch, but we heard the call earlier from Dedido Mayor Melissa Savares, and man, people are hungry. The grab and go meals, I mean, they're just coming out for these meals. The public health lines are all, full up. I mean, people are calling, they need the assistance, and it's a struggle. It's a challenge for them to get the number of employees in there. They need to answer the phones and also obey all these different orders that we have.
And there's 38,000 people that Department of Labor Director David De La Sola is anticipating to file claims. So Definitely going to need more than 3 people answering phones.
Yeah, so I mean, I guess Hannah says it is working, but I say it isn't.
Yeah. But thanks, Hannah, for that update, and thanks to the people that are having to answer those phones. It definitely appears that you guys need some help.
Right. Okay.
Thank you.
9:20, and like they always say, it's a rapidly evolving situation. So we know that the Joint Information Center is listening. Good morning, Jick. And so they kind of take what the concerns, questions that they hear, not just on this show, but on all the shows across the board. And they kind of, put that in their shirt pocket for use later. But yeah, this is rapidly evolving. This is an example of rapidly evolving. Get more people on these phones.
Also, Heidi Ballendorf, she's the spokesperson for the Guam Waterworks Authority. She just wants to remind people that she has a new schedule. That GWA, has a new schedule. The GWA Upper Tumon Customer Service Center drive-through window opens at 6:30 in the morning to 3:30 in the afternoon. They'll continue to take all forms of payment for GWA and also GPA customers. And this is available Monday through Friday for the duration of the shutdown. And I believe she said that they will be open on
Good Friday. Yes. Yeah. Something that will not be open on Good Friday. The Department of Education's Grab and Go Meals program is not going to be open tomorrow on Good Friday. So I don't know if you're able to get a couple extra meals. I mean, these guys are working hard to get 150,000 meals a week. Yeah. I mean, they're basically giving every person on Guam, and that's what's crazy. And where are the resources? Where is Adelup? Why are they not coming to the table and saying, "Hey, we see what you're doing. We want to help." Mm-hmm. And I made the call again. I think the governor needs to go out and see firsthand how many people are going out here trying to get a free lunch or free breakfast?
People aren't recommended, though, to go.
I know. She's the governor, man. She's in charge of the island. She should go out and see how everyone, what's going on. I know. Stay home, right?
Yep, stay home.
Okay, 9:22. I just wanted to read this Port Authority concern, and I got a response from the GM, Roy Respicio. This comes from a concerned employee. The port had been deemed one of the essential agencies by the governor, but in these efforts to reduce the spread of COVID-19 and with all the implementations to minimize contact, is it really necessary to have 100% of Port Authority employees on full schedule? There have been requests for accommodations for those who can work from home to have that access and only come in when needed to ensure that the most important functions are done so that the contact and exposure can be limited. But the response to these requests have been that every single employee is essential and required to work. Thanks. A lot of concerned port employees worried about retribution. And that's a common story you've heard at the port for many years about. I don't know if it's just inherent in the management structure or what, but the response that we got from the GM, Rory Respicio, I've taken the position since day one that since we are required to remain 100% operational, everyone working at the port remains essential to keep the supply chain flowing. We have instituted these extraordinary precautionary measures since February 18th and follow the governor's directives and public health notices on CDC guidelines. This is also the reason why we asked the governor of public health to open up a port clinic. Early on in this pandemic, we looked at running a skeleton crew, staggered hours, or having employees work from home. We're just not set up that way. How can operations, maintenance, HR planning, and even finance folks work from home? It's all hands on deck. Finance needs to continue to bill I order to generate revenue and make payroll. Planning is working cohesively to pursue grants during this pandemic. And if anyone is non-essential at a time when we are 100% operational, then that'll mean the port is overstaffed, and that is not the case at all. And that's tough for these managers. I mean, how do you manage having to go to work and the port is essential, but also consideration for what these employees are feeling in terms of leaving their families behind? I mean, this is something that we kind of struggle with in going to work. And it's a real concern. I just wanted to air out both sides there. And 9:23, Bree?
Yes.
I don't know. You're giving me the, I got something to say look.
Not over the air. Look.
Okay. So we can take a break. Okay. It's one of those. We need a vent moment. Okay. And then when we're done venting, we're going to go to Maina Church. Are you guys ready?
I'm ready.
We want to get Father Richard Kidd up here to, address us on a Holy Thursday and, find out how he's been doing. And there's something really cool that they're doing at Maina Church. So watch our Facebook page. We're going to tell you how they have been honoring and celebrating, Holy Week traditions while staying home and following the governor's orders. That's coming up right here on Containing COVID. Good morning.
Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more.
so hot.
Hey, remember, who got the power? We got the power to kill the curve. Okay?
And all you got to do is stay home.
That's all you got to do. You know, senators, they don't need to go jump through all the governor's hoops and do this and do that and give them more superpowers. Yeah. They don't. We got this, Guam. You never know how the session and the politics. I mean, how do you have time to play politics at a time like this? Let them sort it out. Mm-hmm. We just got to keep doing our part to kill the curve. I don't want to flatten the curve. I want to kill it.
Kill it.
Yes. 9:32. Let's go over to, we have Father Richard Kidd just moments away, but we got to get Sergeant Paul Tapau
hey, Paul.
On the line. Good morning, Sarge.
Hey, Hospitality, good morning. Hope everybody's staying safe. God bless everybody.
Sarge, I just want to start off by asking, how are you doing?
I'm doing good. You know, been doing a lot of different things with at home and, of course, here at work. So balancing work and what's important is at home is really, it's been fun. It's been challenging, but, you know, nonetheless, it's really what is needed to be done. So
right, and now you guys have been stepped up. We know in the press conference a couple of days ago, the governor said, "Hey, I asked the chief, what can you guys do? I don't have the power to do the whole checkpoints, whatever police. So you guys are doing what you can do, right? Which is this omnipresence and being out there. And let's talk a little bit about this from start to finish, Sarge, the mobilization of the Guam Police Department."
Yes, so, you know, when we talk about the omnipresence, we understand that, you know, because of the home isolation, of course, based on the executive order by the governor, we want to make sure that there's still, you know, there's still safety and security in the community. So in providing the omnipresence, we're seeing more of the officers out there doing traffic enforcement. And I want to assure the community we still have our basic, you know, structure with patrol function. Our investigators are still attached to the Criminal Investigation Division. We still have our curfew task force and, of course, our COVID-19 response team. But, you know, with the uptick in fatalities, and, you know, I'm waiting for the approval. We just had one earlier this morning. So this brings our numbers of our fatal crashes to number 8. And, you know, we are only in April, and that's the 4th month of the year. And we're seeing, you know, 8 fatalities in 4 months. It's really, we're seeing an uptick of that, and we're stepping up and we're ramping up our speed enforcement in the daytime, and of course we made the announcement of the DUI checkpoints or DWI checkpoints. So this is really to address the issues of what's happening with, you know, our fatalities, and of course, you know, providing the omnipresence, assuring the community that the Guam Police Department is there to assure the safety and security within the community. But you know, you'd be surprised, since we started doing our speed or our traffic enforcement, we've been really hitting vehicles that are traveling way beyond 35, and you know, people are forgetting that there are still laws and there's still rules that they need to follow, and you know, it's important that we maintain order and we maintain the calm, and of course we provide the safety and security. So these are the efforts in which the Guam Police Department has been providing to the community prior to the onset of COVID, and of course where we are now with the COVID operations.
Because there are less people on the roads, because you said that people are traveling, speeding, is that what we're seeing? Because there's less people on the roads, that people are taking advantage of that and thinking that they can go gazillion miles per hour, and that's where we're seeing some of the fatalities?
There's a lot of things that are attributed to the fatalities, but, you know, when we do crash investigation, we look, that's one of our top 3 tiers is speed, alcohol, or inattentive driving. So, you know, we can eliminate one of the 3 factors, which is speed, and of course provide the education and assuring the community that, you know, our guys are there for a purpose, and that's really to educate. Although you may receive a citation, and now, I'll be honest with you, when we started doing this, you know, we've clocked somebody going 90 miles per hour. We've also clocked somebody going 85 miles per hour, and that's fast.
Yeah.
You know, I do want to say what I want to say, but I can't because of FCC regulation, and that you know, in police language, that is freaking fast, and you know, it's
official terms, no, Sarge, that is freaking fast, bro.
It is, you know, and you know, being a former crash investigator, when you look at metal when it's mangled based on speed and the crush analysis, It's who's going to survive that? Nobody's going to survive that. So, people need to take into account that although there's a lot of things that are closed, there's a lot of businesses that are closed. People are home. The roads are not an open, autobahn where people can be driving at that rate of speed. So we want to make sure that people understand, and we want to bring bring down the fatalities by eliminating one of three of the top tiers of the causation of the crash, which is speed, impaired driving, and of course inattentive driving.
So, preliminarily, was there any indication that the last few crashes involved alcohol?
We're looking at speed, and of course,
so
with the alcohol, and of course all the other impairments, we would need to wait for the autopsy and of course the toxicology report. And unfortunately, since the onset of COVID, the restrictions of flying in our pathologists from the U.S. mainland or even Saipan, they would have to forego a 14-day quarantine. So their primary area where they practice, it's really the call for and the need of. So that's where we are, based on with our fatal investigation is really determining the toxicology reports to find out whether that alcohol or any other drugs were factors of the crash. But with the last few crashes, we've actually we're leaning towards speed based on some of the calculation and of course the evidence that are gathered. And these are things that you put a combination of speed and impaired driving, it's something bad is really going to happen.
Can you just provide us the information on this latest fatality, where it happened, what time?
Yeah, absolutely. So we got a call. The editor precinct received a call around 1 o'clock this morning. A passerby called it in, and our officers arrived on scene on route. The crash occurred in Route 15. This is the back road to Anderson, and it was right by the former Anderson South housing area. Vehicle was found off the roadway, and preliminary reports had indicated it collided with a concrete utility pole. Medical units were there on scene, and they rendered that the male lone operator of the vehicle, or lone occupant of the vehicle, the operator, was lifeless and pulseless, and was transported immediately straight to the morgue and bypassed any life-saving measures. It was, it's that instant, that tragic. So, that's where we are. The official release should be coming out soon. I'm waiting for the approval from, of course, my upper command. So once we get that and we put that out there, just to bring into reality, that's our 8th fatal crash that occurred on our roadways of Guam. And when we just had one, I believe, 2 days ago, three days ago. So,
and there was one in Talafofo. That was I want to say like a week and a half, maybe on a Saturday. I remember I responded.
Yeah, so these are things that are happening, outside of what's going on with COVID. So, when we made the announcement of the DWI checkpoints, it was really to address the issue of what's happening with our fatalities. But the message was there, to prevent this from happening, just stay home.
Yeah.
Stop the spread and stay home. And I mean, realistically, why are we going to really be looking for places to drink and party and stuff when the executive order speaks for itself? Stay home, man.
Yeah,
it's just some serious stuff we're dealing with.
So hopefully, if everything goes right, you guys are going to set up a DWI checkpoint, and you're just going to be looking at each other, because everyone's staying home.
Hope so. We hope so.
Perfect world.
We've been we've been fielding questions of how we're going to actually implement and deploy our DUI operations, and I want to assure the community that our officers that are out there doing the speed enforcement, we have PPEs, they have masks, they have gloves. They understand the social distancing. All they're asking for is just driver's license, registrations, and insurance, and of course, decon, and of course, how we decon ourselves after every operation. It's we've every officer has gone through the training and donning and doffing PPEs and stuff. So there's an understanding, and of course, the question was asked when you do your DWI, how are you gonna provide samples of alcohol or drugs? So we have a protocol. We have a unit director from Highway Patrol in how to deal with if somebody should administer the breath test how we're going to properly deploy that, and of course utilize that unit directives so that we can safeguard not just the person that's taking it for the suspicion of driving while impaired, or you know, and also our officers that are working. So, you know, the checkpoints are not going to ask you, you know, why aren't you home? It's really the greeting process when you randomly are selected to, you know,
why not?
We do ask them.
Yeah, they do.
Where are you going?
I got pulled over and not during COVID, and they asked me where I'm going.
Yeah.
So, yeah.
So that's part of our greeting is half a day. You know, you've entered a DWI checkpoint. Where did you come from?
Right.
Have you been drinking, or where are you going? So, you know, we use that opportunity to find probable cause, you know, and of course with the passage of the recreational use of cannabis, you know, that's one of the things we got to look for is sticky Dorito fingers and stuff like that. I'm kidding.
You got hot Cheeto dust all over your chin. Where the weed at? Get out of the car.
Those are evidence, but you know, our officers are trained. You know, we have advanced rules.
That's not cocaine, officer. That's powdered donut sugar. You can test it.
But yeah, you know, that's the whole purpose. That's where we are, and you know, we want to. Somebody asked, is this in line with COVID? And you know, really, when we deploy our DWI checkpoints, it's in line with the holidays. As you know, traditionally this is spring break. Students are returning home from college, so we see an uptick of people going out, people visiting patronizing our local establishments, our local, you know, pubs and stuff. So in line with Christmas break, in line with the summer vacation, you know, this is the time when we do our DWI enforcement. So, you know, it's in line with what we need to do and provide the service to the community.
Yeah. Well, we appreciate everything you're doing, everybody over at the Guam Police Department. I mean, if there are people driving around 90 miles per hour, you guys need to be out there.
Yeah, you guys don't want to go to DOC. They're dealing with their own little COVID crisis that, you know, God bless them when we pray for the best, but definitely just stay home. I mean, the science is it's proven. It's proven scientifically. If you stay your ass home, you're not going to get into a car accident. You're not going to get DWI. You're not going to get a speeding ticket. You just stay home.
Yep. Let GPD stand around.
Yeah. Let you guys stand around and look at each other, all handsome policemen and women. Thank you,
man. We appreciate it.
Of course.
Thank you guys. You guys stay safe and please continue to keep providing the community with the information that's needed and moving us forward. You know, I think information sharing and both what we put out from the government and of course what the media puts out, I think it's really important as a holistic approach from the community. So thank you guys for everything that you guys do.
Sarge. Sarge, I want to wish you and the family and, you know, all the men and women in blue a happy Easter.
Happy Easter to you guys. God is risen. Take care, guys.
All right.
Wash your hands, Sarge.
Will do.
Okay. There you go. Sergeant Paul Tapao, 944.
That's freaking fast.
That's freaking fast. How many miles was that? Oh, freaking fast. Boy, I'm getting 2 tickets. All right. 9:45, Holy Thursday.
Okay, yeah.
You ready to put your...
Yeah. Okay, now it's serious.
Okay, no more freaking, no more.
No more. Hey, you started.
You're not even supposed to be talking loud. Let's bring Polly Richard Kidd up onto the show from Maina Church, of course, Our Lady of Purification. Good morning, Polly.
Good morning. Good morning.
Half a day.
How are you guys doing?
We're doing good. I just want to start. I got a couple questions, and then we're just going to clear the floor. I know that you got some things that you want the people out here to think about, but we had saw on the Maina Church Facebook, and we're going to pop these pictures up on here. Yeah, that you guys had done a little like Palm Sunday, your door. You know, people always put the palms out, and so on that Facebook page for Maina Church, I saw just a bunch of cool pictures. Can you tell us about that?
Yeah, well, some of my classmates in the States, you know, we pass each other some ideas to help share with our parishioners. And, well, one of them said, hey, you know, why don't you try this? And I said, that's good. I got a few, I went online to look at some of the more detailed sites about it. And I said, I think we can take this idea. It's a great idea. Just adapt it for us here on Guam. I added a few little things. Some of the other pastors on Guam did the exact same thing. I put together a little kind of a media blurb that I did on Photoshop and shot it out to all my parishioners. It actually made its way all the way to Virginia. So some of those people who posted pictures on our Facebook are actually Chamorros from the States who I have some connection with. One of them whose wedding I did about 2 years ago. So they're not all local Guam photos. The majority of them are, of course. But that's what it was. It was a way for us to connect. I mean, we're disconnected at this point, and social media has helped us stay connected. And some people, you know our Chamorros, you know our locals. We're very tactile people. We want to be able to hold things, to see things. Visualizing is of course good. I think many people do that when they go to the beach. But on a day-to-day basis, we're community-oriented people. And how can we get them to be able to participate in their faith, show the joy of the season, and share that with others at the same time, and put their hands to work? And this was one such way. So it wasn't just silent private meditation, staring at some sacred image or out into the sky and praying, but it was truly working with their hands. And for me, I think that truly brought a lot of joy to people to not just share, but to work together with their family. I mean, so you see the musicians doing it today. It isn't anything different from what they're doing, and I would just think is a great thing. And the more creative we can get in our island, the better. I mean, you said it before. We don't know how long this is going to be. It's just the reality.
Right. And in your parish in Maina, I mean, that's a small community. Everybody knows everybody. I mean, you say that on Guam, but I'm pretty sure in Maina everybody really does know everybody. How has your parish been dealing with this COVID-19 and the fact that Holy Week they're not able to do the things that we've been doing, our entire lives?
Yeah. Well, I'll say this much. I think most of the people that I've spoken to, they've put themselves in a very, very interesting mode. Why I say interesting, because it's something that I recall the elders telling me about their experience during World War II. For most of us, this is an unprecedented Holy Week. There are many people on this island that are going to go without physically being in church. My parishioners have expressed that much. Bebe Santos is what we call it, where the church intends to renew, kind of like an anniversary, this in the most solemn of all manners, the mystery of the Last Supper. For those who don't know, just to kind of throw a little bit in, on this occasion, we remember the institution of the Blessed Sacrament, where the Lord said to his apostles, "Do this in remembrance of me." This one of the most solemn masses throughout the year, celebrated with grand hymns, ornamentation, bells, smells of incense. We recall the gospel. We listen to the gospel, recalling the Last Supper. We experience the washing of the feet, at least symbolically. We focus on the Eucharist at the end of the liturgy with prayer and meditation, and on what we call the monumento, or after Mass is the place where the Blessed Sacrament is reserved to the side of the altar. Many people even drive around the island praying at these monumentos that are set up in different parishes. That movement, well, that won't be happening tonight. During one of the holiest times in the liturgical year, we're not able to congregate for this Mass, nor drive around to visit those different parishes because we're asked to stay home. And this can't be easy for many of the faithful. But I want to share something very applicable to this time that many have probably not even noticed about Holy Thursday Mass in the past, simply because we were living in a fairly good time. And this is something that I actually shared with one of my parishioners who asked me the very same question you're asking me now. All these joyful grand hymns and ornamentations that normally would adorn the church, the church has woven into the rituals of this Mass tonight, which will be aired live, of course, but without physical presence, elements that ensure that we have not forgotten the passion of Jesus. In a way, these elements are on purpose, is to remind us that this joy that we enjoy is transient. It's only temporary. And one of those joyful elements, the ringing of the bells, for example. I mean, if I got that. You're a little, it's Holy Week. I had that passed around to me 9 times. And I said, I love this, but 9 times, okay, not out of front because, but it's a silent time. So these joyful elements, like the ringing of the bells in church, well, they remain silent after the glory to God during this evening mass until Easter Vigil. There's a quote from an abbot that I pulled up, and I think it's perfect. He wrote about these liturgies over 100 years ago, and he said their long silence, referring to the bells, their long silence produces in every heart a sentiment of holy mournfulness. It's to show us that this world lost all its melody, lost all its joy when its Savior suffered and was crucified, reminding us how the apostles, who were supposed to be heralds of Christ, are figured by the bells, whose ringing summons the faithful to the house of God. Well, they fled from their divine master. They left him prey to his enemies. But today, today we were talking about social distance and don't shake hands, etc. Today we even remember the traitor Judas, who profaned the sign of friendship by making it an instrument of death. Another symbol, which many people probably don't even notice, is right after Mass on Holy Thursday, the priest removes all the altar cloths, removes all the ornamentation. It's meant to be a visual reminder that Mass is suspended. And then it's another way to call to mind the gospel accounts of how Jesus was handed over to his enemies, how he was stripped of his garments, just as we stripped the altar to be exposed to the naked insults of the mob that called for his crucifixion in the first place. And in the very beginning, I want to clarify. I said we can say that in this situation it's unprecedented. But Amaramko, especially those who were teenagers during World War II, who are all now in their 90s, and can truly recall the sights and the sounds of Japanese occupation. This suspension of Mass situation, which hurts a lot of people, including myself. I mean, I'm a priest. I'm used to being with people. It's hard to preach to a camera. It's hard to connect. I don't know how you guys do it, but you've been doing this a lot, so you do a great job. But I don't know if I could be able to do the same. I probably could, but at this point in time, I don't know. But this suspension of Mass, being deprived of typical community joys, this isn't unprecedented to them. And we can learn a lot from their resolve, from their hope, their strength, their faith, their peace, their patience. I don't know if you remember that song that somebody came up with, Sam, oh dear old Uncle Sam, won't you please come back to Guam? That melody, think about all the musicians that have been on their own, just playing to their neighbors. I mean, Joe Guam, he's one of the guys he's one of my parishioners. He started something. The Manila Choir started another thing, and there's a few other musicians that off the top of my head I can't remember, but more than I can count on my two hands that have tried shared their particular talents with other people. So are they recalling something that our Chamals did during World War II? Yeah, of course I think they are. And I think this is the strength, the faith, the peace, and the patience that they're sharing with our community and others as well to teach us their resolve, their hope. Every year in July we recall all these stories shared by those Manamko who lived through World War II and after. I'm not going to dismiss those that were babies during World War II because they did experience the aftermath as they were growing up. And these stories every July, they're not for some cuteness factor from storytelling purposes, but for us to be prepared for these exact moments, for us to learn how successful they were, how strong they were, and that we today can be prepared for a similar situation. I mean, this isn't war, of course, but some of the deprivations we experience today, we can learn a lot from how they, in the past, dealt with it. There was one Manamko who said to me, and this is really old school Catholic Manamko talking here. I said, Pali, the believer has to have a healthy fear of God. It's a Christian resignation, Pali. He said, si Diyos mas tumungo sa gwida lamang. God knows the best. He's the one. He's the one who will take care of everything. In the midst of this joyful day that we're preparing to celebrate online, in the privacy of our home, in the domestic church of the home, there's a lot that we can learn from the joys of the splendor of the liturgy, but also those moments in the liturgy that remind us of the Passion. There's a lot that we can learn from our Manamko, who even on their own, in the midst of those deprivations, that they still had hope, and they still found joy in the little things that they could find joy in. Any element that we can use to help uplift us is something that we continually need to search for. I can only say to people, I realize that there's a lot of frustration, and many people are even lashing out with anger. I see it on social media, and I've heard people screaming too. There's a time and a place for it, but right now, with the disconnections that we have, physical disconnections, that's who we are as people. We love to hug each other. We have to sit with each other, eat and drink with each other. In these particular times, this is the time that we need to draw from deep down, the core of who we are as Christians, as who we are as islanders. And dig down and deep. Si Jesus mas tumungo sa Rizalaman. Sorry, I talked too much.
No, Paulie, thank you so much. You know, you really put it in perspective. This was something that the governor kind of touched on in a press conference when she said, you know, for the first time since World War II, but I appreciated that extra insight and, you know, to compare what they, our uncle went through. And this is a conversation we had last year with, you know, the big liberation celebration and, of course, with the war claims and everything. So it's been in our mind, but I think a lot of us weren't able to make that bridge and put it all together and you know, realize that we're going through something similar to what they went through. And you're right. We look to them for their strength and their inspiration. And if they made it, then, you know, God willing, we can too.
Amen to that. We can.
Amen.
Polly, can we get a little penance because tomorrow's Good Friday and, you know, we're supposed to be quiet, but we got to do this show because there's still a lot of info to get out to the people. Are we covered? Are we okay?
I think every single one of us, to the extent that the individual can do with the limitations that we are in, we are placing ourselves in the same merciful and loving hands of God. I mean, think about all the many people who during the war had died without sacraments or even to this day living in countries with war or unrest. They themselves were probably deprived of these basic tactile elements. So here we place ourselves in the loving and merciful hands of God and ask Him in His most mysterious way to come down upon us and grant us the forgiveness that we need, but the consolation that we also need, so that we may be able to spread that love and that joy with others. You know, Scripture says, "Step out into the light, so that it may be plainly seen that what you do is done in God." And I think that is something that we should hold on to as we continue forward, and not let Satan come in and frustrate us so that we fly back into the darkness. May be plainly seen that what you do is done in God. Have a blessed Holy Week, guys. And when it comes around, Happy Easter. And Chris.
Yes.
Pagasi ka na mo.
Agumas, Paulie. Thank you.
You're welcome.
There you go, Father Richard Kidd. Good stuff there, Bree.
Mm-hmm.
Good stuff. So there you go. I feel like we've talked to a lot of priests this week, and it's almost like in its own way being in that Holy Week Mass setting.
And we're also going to be broadcasting and streaming masses this week.
Yeah.
Jason has a schedule. I believe it's posted online for everybody to see. And
growing up, man, Good Friday, my grandma did no radio at all. So throughout my careers, you know, on the radio and stuff, it was always Good Friday. And, you know, radio, there's a saying, old saying in radio, no holidays. And so I'd always come in and always kind of try and keep it down. But I always thought about my grandma, and I'm pretty sure we're going to be thinking about that tomorrow. Good job today, Bree.
Good job.
Right on. And thank you guys again to, you know, all of our frontliners. I want to give a special shout out this morning. As I was on my way into work, I saw the Department of Public Works, a solid waste division, the trash trucks. They were out rolling. And so I want to shout out to the guys who pick up your trash. You know what I mean? They're out here. They're doing what they got to do. Shout out to all the little people who are doing the little things that we sometimes take for granted. Thank you guys so much. And I know, Bree, you got some shout-outs you want to do before we go?
Yeah. Thank you to our frontline workers, all of the people in the National Guard that are out there every single day, the police department, the fire department, the nurses, the doctors, the people that are working at the Salvation Army, Catholic Social Services, the grab and go volunteers, and also to the musicians that are helping us provide a little bit of positivity. And you can watch them tomorrow night at 6:30 on KUAM TV 8.
Okay, and if I may, I want to give a shout out to everybody who is working in retail right now, like the grocery store employees. Many of them have reached out to us. They say they're very anxious, but at the same time they're like, hey, this is our job and this is how we can serve the community. The gas station attendees, the grocery store workers and everything, everybody who is
running a register and doing the customer service
exactly
thing.
doing what they have to do so that we can continue our lives. And all we have to do, the rest of us, is just stay home and save lives.
And one more shout out to everybody working in the media. It's a lot of information that we have to provide to the community, and I think everybody is working their darndest to get it out to all of you, whether you work in print or broadcast. So kudos to all of you.
There you go. Hey, this has been Containing COVID, the KUAM News Takeover of Guam's favorite I-94 with KUAM FM in Agatnia, Guam. For my co-host and my partner in bringing you this info, Sabrina Salas-Mantanani. Thank you, Bree.
Thank you, Chris.
My name is Chris. Está. Adios.
Bye.